Не чую. Чую. We're starting in 2 minutes, so yeah, please stay here, and I'm welcoming those who are outside. 1 second. Good afternoon to those who are offline today with us here at the perfect venue and those who are now online. I'm welcoming you, all of you, at our final event of Generation H Health Tech Initiative. My name is Jane, and I will be the host of today's event, but also I'm supposed that you know that I'm a director of innovation and entrepreneurship of SAT University, who has organized this incredible activity by supporting Takarev Foundation. So it's super amazing. It's really amazing to see familiar faces too, and those who are new one, for me, of course, too, and for our community. Today's event will be divided into 3 main blocks. We're starting from insights and different talks about the health tech, not only in Ukraine, but abroad too, because we have excellent experts bringing their insights today. Of course, we're waiting for the pitches, and then you can celebrate this, not only this event, but today's evening with those who will be awarded or not, but bringing your insightful thoughts about their projects and their products that you will see today. But I want to start from welcome words, of course, of our guests. And first of all, I want to invite here to this stage Igor Kuzin, Deputy Minister of Health and Chief State Senator Doctor of Ukraine. Igor, please.
Добрий день, шановні колеги. Я виступлю українською як державний службовець. І я би дійсно хотів привітати вас всіх з таким чудовим заходом. Мені дуже приємно сьогодні бути тут, і насправді цьому є декілька основних причин. Перше – це те, що дійсно в секторі охорони здоров'я інноваційні рішення, штучний інтелект, механізми або підходи до обробки великих масивів даних впроваджуються з надзвичайно великою швидкістю. І, безумовно, Україна спроможна і має бути спроможна до подальшого розвитку цієї галузі як всередині України, так і на світовому рівні. Україна містить достатньо велику кількість унікальних даних. Ми маємо точно також величезні масиви вже накопиченої інформації, яка стосується блоку охорони здоров'я, який можна і треба використовувати для подібних розробок. Тому я дійсно вітаю вас як учасників, і Takarev Foundation також дякую за запрошення і за ініціативу, за підтримки цього напрямку. І хотів би, напевно, сказати декілька таких речей. Перше, що Міністерство охорони здоров'я буде зацікавлено в утриманні фінальних продуктів і фінальних результатах. По-друге, Якщо будь-які поточні або майбутні команди будуть стикатися з необхідністю допомоги до даних, до пацієнтів, до лікарів, і будуть вбачати тут потребу в спілкуванні з Міністерством охорони здоров'я, то ми будемо завжди раді відповісти на ваші запити. І третє, я би, напевно, хотів сказати, що я вірю в Україну, точно також, як і всі ви тут. І я впевнений, що наші проєктні команди, які не лише сьогодні представлені тут, але і є на території України, вони спроможні і обов'язково стануть провідними по цьому напрямку в усьому світі. Тому дякую і бажаю успіхів.
Дякуємо, Ігоре. Thank you very much for your attentive words and so perfectly tone for our today's event. The next speaker will be Anastasia Deva, CEO of Takare Foundation, and I'm happy to welcome you.
I hope. Yes, great. Thank you so much. And I really want to start that I'm super proud of you. So much, because this is our first cohort of health tech businesses in Ukraine. Why it is important? Because actually this is how we do the attempt to overcome the human capital crisis, to overcome that social and health crisis that we have in Ukraine because of the full-scale invasion of Russia and war, but also it's because Ukraine is not a country that comes to others to ask for help, but actually Ukraine is a country that creates the innovation, that creates the solution. And we've just got back from Bilbao with Alona, who is here. Thank you for joining us. And it was quite astonishing to see almost all of the most prominent impact investors from all Europe, but also philanthropists who invest their money into the impact businesses. Impact business is not now something that good to have. Impact business is something that must. If your business doesn't have impact in core, then sorry, but in few years it will be outstanding and more obsolete than others. For the last sociological and also number research, we saw that impact investing market, the value is around 190 billion euros, and it's only 2.5% of the general market, but it's growing and growing and growing. And can you imagine that health tech is actually one of the core components of the impact investing in the world? It's one of the most trending entrepreneurship, I would say, directions that we see, and that is very, very quickly developing. It is important for us also that Ukraine is undergoing unprecedented times, and we understand that we have so much of pain, so much of losses, so much of challenges and obstacles. But knowing that we are Ukrainians mean that we have superpowers, mean that we have the superpower to be resilient, to stand up, to actually create something that will be showcasing to the world, and what is called with or without you, right? And we know that this is actually the perfect timing when we need to develop the whole health tech market, because we understand that it shouldn't be blurred, it shouldn't be blur among other businesses. Health tech should have its own place of the development of economy of Ukraine. We had two main intentions, well, actually three, but I will publicly say only about two. The first one is to create the impulse to develop the health tech market in Ukraine, and you showed that you are super actually mature to do that. We started with the Ideaton, where our main idea was actually to join and to gather the teams of health practitioners, of engineers, of technologists, of scientists, and also of programists, how they can, entrepreneurs of course, how they get together and come up with some solution that will not only be profitable and demanded in Ukraine, but actually that can be presented to the world. The second stage is you. You made it through bootcamp, and I'm so keen to see your pitches today. And our second intention was how actually help Ukrainian businesses, Ukrainian startups to become investment ready. So let's see how this journey goes. And of course, thank you so much for SET University, one of the most innovative universities and institutions of Ukraine. Tokarev Foundation is very proud to be a co-founder and to stand by your innovations. Thank you.
Thank you. It's so warm inside. Yeah, thank you very much. The next speaker, actually not with us today offline, but we have a video welcome speech from our president of SET University, from Irina Volnitska. So please welcome her on this stage, on the screen.
Everyone, my name is Irina Volnitska, and I'm president at SET University. I wish I could be there with you today, but I'm recording this video in my room in New York City. I believe that right now I'm flying over Atlantic to come back to Ukraine. You know, like now it's not that easy and takes a lot of time. But hopefully I'm bringing back to our country a lot of opportunities for our tech ecosystem, for our startups, because the world is expecting a lot of innovations coming from Ukraine. Again, because we have innovations by choice and we have innovations by necessity. In our case, in Ukrainian case, we have innovations by necessity. We need to innovate to survive. And a lot of investors like really understand that. They understand this, like I would call it like Israeli model, and they expect a lot of innovations in such industries like military tech, cybersecurity, as well as health tech. That's why I'm really grateful to you for joining this bootcamp. We believe that, I believe that through your startups, we can show to the world how we can transform challenges into innovations, how we can transform these challenges not only into innovations but into the meaningful innovations, because like the world is really waiting these innovations from Ukraine. It is like very efficient not only in terms of supporting a country at war, but it is really effective in terms of doing business, in terms of return on investments. That's why, again, once more, thank you for joining the bootcamp. Thank you for what you're doing in Ukraine, for solving such big problems for our country. And of course, thank you to our partner, Tokarev Foundation, that make it all possible to us in this beautiful format. Thank you once again.
Great words and great thoughts. And so, as for me, actually, we're starting a great moment for this. We're starting from our keynote speeches. And before I'm welcoming our first speaker to this stage, I want to ask you guys, who are the entrepreneurs who are building their health tech startups? Raise your hands. I'm asking those who are offline. Sorry, guys, who are seeing our live. Okay, nice. 30%, even 35 maybe percent. Who are you guys that interested in health tech and want to build partnerships with those innovators? Raise your hands. Yay. 1, 2. Okay, another one. Who are the another part of these guys? Yeah. We're passionate about those who are interested in this sector and industry, and not only today, but all over. And that's why we're building the community. We're having that, but a few words about that will be further. So I want to welcome to this stage Pavel Benes, the co-founder of Phototerra Labs. We are so lucky to have you here in person, actually, Pavel, because this this founder could share his thoughts, of course, and his insights about the building so mature and impactful products in health tech, actually. And that's not only about the Ukrainian paradigm, it's about the building the bridges between the different countries inside this industry. So, Pavel, this stage is yours. Here's your clicker. Yeah, this clicking. Yeah. We will have your presentation in 1 second.
So good afternoon, ladies and gentlemen. Thank you, Jane, for a nice introduction and invitation to Kiev for that presentation. Well, I'm going to tell you a little bit about myself, how the whole story of Phototera Labs started. I studied the chemical engineering and graphic design, so which was basically a good base for me to start playing with the technology of printed light, to mixing up the polymers, to print them on the beginning. Then we started to use this technology for different products, thinking that the main advantage of the technology is its thickness. So we were printing the lighting posters, lighting wallpapers and different applications at some stage, until we went to the point that we've been approached by the Professor Kuchinka from Vinohrady University Hospital in Prague, our #1 ophthalmologist, who wanted us to create a sleep mask for treating diabetic retinopathy based on our technology, just because we discovered that the technology is not, that light is actually one of the few in the world which is not emitting any heat, so we could use it directly to the human body. And based on that, we ran the first clinical trial at Vinohrady Hospital on first cohort of 40 patients with diabetic retinopathy. And then with the support of Czech governmental bodies, we've created our laboratories close to Prague, and we started to develop other different medical devices based on our technology. To say a little bit about Phototera, basically Phototera is pioneering the medical solutions based on requests from professors or doctors from the universities we work for. Our mission is to create the products and put them in the life as the new therapies, which might very well replace the existing solutions. And as I said, we've got a nice facilities in Czech Republic. And since this year, we've created a small research unit for clinical trials at Research Park at Florida Atlantic University in Boca Raton, where we cooperate with Professor Kantorov on eye diseases. And we own the technology of printed cold light. Basically, in our medical specialties, we are right now concentrated on 3 main disciplines, which is dermatology, where we are using different spectra of emitted light for treating skin diseases, basically wounds and bruise healing to speed it up. And we did the first test on the photobiomodulations, the methods where we are combining the light together with other therapies. We call it like the photodynamic therapies, or the therapies where the light is stimulating some other particles or some other elements to heal. In psychiatry, we are using the technology of cold light specifically for bipolar affective disorder, where we have first clinical trials done with our National Institute of Mental Health in Prague, where we are using the blue light to synchronize the circadian rhythms of people with disorders like bipolar or seasonal affective problems. In ophthalmology, we have, which is basically probably the most promising part of our activities, first experience with treatment of diabetic retinopathy by phototherapy, plus there are even like a first patients which has been treated with age-related macular degeneration. As I said, well, the company has been established in 2007 by private investors, and well, as I said, we've been using the technology mainly for advertising and interior design purposes. And since 2016, when we set up the premises, the cold rooms, clean rooms in Prague, we are completely oriented on medical research. As it has been mentioned, we have 3 medical devices for psychiatry, ophthalmology, and dermatology. I will describe them deeper further down on the other slides. There is like a phase 1 trials for the dermatology, phase 1 trials for ophthalmology already carried. We've got R&D team and laboratories in Prague again and again. There's new activities in the United States. To be competitive and to have like a first product, because we feel ourselves as rather research and development company than a manufacturing or let's say a retail company, we can say like downgraded our wound healing patch for a cosmetic purposes, and we are already having the first sales of lighting patches for bruise healing to plastic surgeries in the clinics where they are treating the chronic wounds and similar problems. We are looking for phase 2 trials funding for all our medical devices. What is the main game changers of what we do? As I said, there is no heat generation. We can use the light 24/7 directly on the skin, which goes to a point that we can go deeper with the light under the skin, so we can treat the skin diseases better as the light penetrates deeper. As all of our devices are printed, wearable electronic devices in the category of low-intensity light, we have products which are dedicated to be as a home treatment, so it even like easy the situation of hospital, or the patients are not needed to go to the hospital, which is pretty costly. And well, as the light is, or we can call it as the penetrating photons to the human body, are not considered as invasive. We are talking about the non-invasive treatment. So what are the Phototera's flagship products? It is the diabetic mask for diabetic retinopathy, where we are using the specific green light to avoid the human eye to switch from day vision to night vision, to not overwhelm the eye by a lot of oxygen during the night, and avoid any pathogenic effects in the eye when the patients are sleeping. Bipolar, the second product is the bipolar disorder mask, where we are using the blue light, that light which is usually considered as dangerous light, or the light which is like damaging our sleep. That blue light is effectively working on emission of melatonin in the brain. It says to the brain when the day ends up and when is the time for going to sleep. So based on a system with actigraph with a specific bracelet which is measuring your movement during the night. We are using the blue light to regulate the emission of melatonin and synchronize the circadian rhythms in normal as it should be. And the third product is the wound healing patch, where we are using the yellow and blue light to speed up the regeneration of tissue and disinfection of the wounds. Here, just for imagination, these are our first prototypes of the mask for diabetic retinopathy, where, as I already mentioned, with Professor Kuchinka, we run our first clinical trials on 40 patients, where nearly like 90% of them had significant improvement of their macular edemas and thickness of retina, which has been measured. Some of the patients even had the lower lower dioptrias right after the 6 months period of study, just because the eyesight has been improved that much. And while we are talking about the massive population of people in general, we have in Europe about 12% of people suffering diabetes. Out of them, about some 10 to 12% of them are having the diabetic retinopathy. The current treatments are pretty expensive. The anti-VEGF injections are about some 16,000 euros a yearly treatment, and we are coming with the solution which is totally non-invasive. There's no need of injection into the eyes. We are just avoiding the eye to switch from day vision to night vision, to switch from the rods function to the cones function without the need to supply the night photoreceptors that much of oxygen, and to simply avoid the human eye to have high blood pressure during the night. How it works, I basically described. Currently, we've run our first, the second clinical trial in United Arab Emirates. It happens at the end of a period of pandemic of COVID. So the study has been finally stopped because of a need of beds in the hospitals, but in fact, we already have good relationship with Dubai Health Authority, and the study should be restarted pretty soon. How to approach the market? Typically, to get into ophthalmology guidelines, to convince the health authorities to accept this product as a standard treatment of diabetic retinopathy, but it needs the phase 2 trials to be completely finished. The second product, we call it Lucis Blue. This is what I've already mentioned as well in the beginning. That's where we are using the blue light to synchronize the circadian rhythms during the night. We are lighting by a couple of seconds at the second stage of the sleep to the human eye, again to start emission, to stop emission, of melatonin during the sleep, and to play with internal clocks of the people using that blue light effect. How it works, our patients are sleeping with the actigraph, the wristband, which is basically monitoring their movement during the sleep activities. This data goes through mobile phone application to the data center in National Institute of Mental Health in Prague. They are stored over there, they are analyzed, and it gets the precise analysis of the diagnosis the patients are having. And then from the data center, there's a message sent by mobile phone back to the patients, and the mobile phone automatically starts the function of the mask during the night when it's needed. And the third product, quite shortly, again, we have two patches, that greenish light or yellow light, precisely 525 nanometers of the frequency, and the blue one, the standard one, which is being used as a light, for instance, in the incubators for newborn baby, where we know that the blue light is reducing the level of bilirubin in the blood and having the strong, like, disinfection effect around the wound or bruise. How it works, I basically described during the first couple of nights. We are using the yellow-green light to regenerate the tissue, to speed up the blood circulation in microveins, to faster regenerate the bruise or wound at the end of the treatment. On a parallel, when there is a risk of infection, we are using the blue light to disinfection and to final cleaning of the tissue out of the dead blood, which is basically the bilirubin under the skin. What were our challenges? And well, it's probably typical within all startups in healthcare. I would call the regulatory hurdles, where the situation with the products which are based on completely different treatment methods than the standard ones which I use are a bit complicated, as it is like a novel therapy. There's no classification, so we need to completely convince the reimbursement system and the national societies, I mean the ophthalmology and dermatology societies, to include that new treatment into the guidelines, which is not always easy. The second challenge was the funding constraints, which means there's a big difficulty within startups to secure the funding which is needed for all phase 2 trials and deployment of the product from private investors, because once you go for funding, first of all, the clinical trials, there might be issues during the time of the trials. There might be unexpected things which might make the trials not successful, so there's not much will from the private investors to fund something which might have the results after 1 year, and the results are not completely 100% sure. Even though we have the phase 1 trials, we know that things are pretty well working. This is very difficult to know how to overcome it. And well, I have to thank to Czech authorities, and recently in the USA as well, where we get funded from public funds for preliminary tests for development of the products themselves, and so on. The third challenge is the market education, where we need to do evangelization of the therapies across all medical disciplines, what I've mentioned, to constantly explain, to do these seminars, to teach the doctors how to use it, what is the principle, and where is the beauty of the product itself. Solutions and strategies. Of course, over last 6 years, we've created a strategic partnership. We very closely cooperate with Department of Dermatology and Department of Ophthalmology of University Hospital at Vinohrady in Prague. We do all psychiatry research together with National Institute of Mental Health in Klecany, which is basically in Prague as well. We have a contract with Dubai Health Authority on clinical trials to be done in Dubai Hospital, and recently we've been accepted to research path at Florida Atlantic University because their College of Medicine is extremely interested to do the research at the university based on the different eye diseases out of those which I already mentioned, like green glaucoma and the other ones. We need to run the robust clinical trials for all of them. And again, that's what we already started, what we do, the massive healthcare professionals education. In Ukraine, I actually had a chance to be in Kiev 2 months ago. We went with our first samples. I must say big thanks to Dr. Luba from Fofania, who took our first samples and been working on them over the last 2 months. We also cooperate with charity organizations which are distributing the light patches to field hospitals at the front line. And hopefully we might have also some data collection from these activities directly from the field. This slide I actually prepared because of the sleep mask for bipolar affective disorder, which might be extremely interesting product for Ukraine right now. Bipolar affective disorder is happening because the people are not sleeping well, because they have an interrupted sleep or they work on the shifts, on the night shifts, and their internal clock are completely in disorder. And think what is actually the situation which is happening in Ukraine when you are facing the alerts every night. Actually, yesterday that was not that much, like 2 months ago, but once you wake up 6 times during the night by alerts, you have to go to the shelters. That's absolutely clear that your sleeping rhythms are not in normal. And looking on it from like the perspective of capacities and how usually the psychiatry or psychiatric facilities are set up in each country, it's usually being done for like 1% of the population. And in case of Ukraine situation, this is absolutely not enough, and it is clear that at some stage there will be a need of a treatment, which is the home treatment, and the system of the bipolar affective disorder mask together with the actigraph might be the one. What is the future of phototherapy? Of course, there is plenty of other applications where phototherapy is used, and what you can see is our first tests in the Košice in Slovakia Children's Hospital on newborn babies, where we had a chance to test something what we call neonatal jaundice blanket. Again, a system of treatment of bilirubinea, the jaundice, which is happening to 60% of the newborn babies, by a tool which can be delivered to home, and which is like saving the time of mothers in the hospital. I can go home much more faster than usually, for instance. Of course, there are the other products I don't want to mention right now. We are up to global reach. All of the products are not locals. They have the ambition to be a global products. We are working on integrating AI into the products, so the products are completing the data and analyzing the data and giving the much more better picture for the patients. And well, at some stage, we are up to set up advanced manufacturing unit, because for now, even though we have beautiful facilities for research and development, we might start to produce in the quantities. As I said, well, I've been here already 2 months ago, and well, there's a big will from our side to help Ukraine as we can, and well, we are ready for technology transfers, for partnering with the local medical professionals. We would like to cooperate on the research, if possible, and well, as we are already doing, provide the humanitarian aid. Call to action: if there are the investors in here, it is a great chance to invest into the future, into the products, at least one of those trees which might be interested. If there are the young students or postgraduate students who might want to develop the ideas what I've presented, we'll be very happy to join forces with them and start to work on the preparation of the phase 2 trials. And well, if there are representatives of the hospitals or healthcare parts of this country, we'll be very happy to integrate our devices into your practice. Thank you very much.
Thank you, Pavel. But may I ask you, yeah, I'm here. While we are waiting for the next speakers and panel discussion, yeah, here, please. May I ask you as a founder, because we have so much founders today here, you were talking about the building the bridges and partnerships with clinics, with corporate sector, or even government sector, if we are talking about some hospitals. How you do that? So what the main algorithm of building this trustful partnership with them?
What a question. It will sound pretty, no, well, I'm not going to say it.
For example, on the case of Feofania, as you are working with them and you have some pilots with them, so how they are opening to that?
Well, it's about like the doctors are usually knowing a lot about the phototherapy. Phototherapy is a method of treatment which is known since Avicenna times of the ancient Rome, so we know what each color and intensity of light is doing. So we are just delivering the products to their consideration, and they pretty well understand where the principle is. There are these studies from the past done on the LEDs or other lighting devices which are unfortunately emitting the light and cannot be used for the examples what I've mentioned. So they are smart. They understand very well what is behind that effect of light in that particular disease what I was talking about.
Thank you very much. Thank you, Pavel. Applause to you, of course. And Jan, we're going to the fireside chat that we'll have for this moment. Thank you very much, Sophia, for supporting you. And I want to introduce you those speakers who will attend this fireside chat. We have an interesting topic for it, because now we will talk about the Ukrainian paradigm and these cases. So I'm welcoming here to this stage Yana Koldra, Sin Labs and Medical Procurement Ukraine. And of course, you, Katerina Potapova, GMK, and the founder of Health App, Heal UA.
Okay, it works. Okay, hi everyone. Nice to see you all and happy to participate in today's event. Thank you for inviting us. I'll start with introducing myself, I'll speak a little bit about my background so we can continue with the discussion with understanding where my insights are coming from. So I'm a co-founder of Scene Labs. We help AI acceleration through expert medical data annotation for machine learning. And our mission is to bridge the gap between raw data and actionable AI models and help companies to deploy faster, more efficient, and more compliant. We know that on average in AI development, data preparation takes approximately 65% of the time. So it means collecting data, cleaning it, curating raw data, while leaving only 35% of the time for other important tasks like training, testing, and deploying the models. So what we are trying to help companies with, our clients with, is to speed up their journey towards deployment the models, increase accuracy of their models. And our network includes medical doctors, biologists, geneticists, researchers, and students who provide specialized expertise for data annotation, and they are supported by data scientists in our team and machine learning engineers, and that leads to higher efficiency and better outcomes of the models. So this is what we do. And for the past year, I've also been active in Ukraine. I lead development of the national procurement and medical procurement and supply chain platform. What we do, we build the national system that covers all state healthcare facilities. We have over 3,500 hospitals that already use the system, although it's still in development. Some functionalities are already available and deployed. So what we do, we provide hospitals and national system, including the Ministry of Health and Department of Health and other stakeholders, to control full information, gather full information about medical goods inventory in the country, to understand what are the stocks, where are the imbalances, what are the needs, and how to optimize and plan deliveries into all the regions and understand how to optimize procurement. What we are aiming for is to help to achieve the principle of money following the patient, where we integrate with other national systems in e-health, and we can see what was prescribed to a specific patient, and then we can control that this exact patient received the needed medicine. So we can match prescription data with inventory management data and delivery data, and therefore we can control everything what was purchased from the state budget, but not only the state budget, also local budgets and other sources of financing, and match all of this information, optimize logistics, cost of logistics. So it's a very large project, and the implementation will take time. We are in our second year of development, and we will start implementing new modules this year together with healthcare facilities. We communicate a lot with hospitals, with Department of Health. The challenge of the system and its implementation, of course, it's a very specific user. In some hospitals, doctors are using the system. In some hospitals, we have nurses who have very limited experience with using any type of software. So our challenge is to build a very consumer-friendly solution. And this is what we're working on. So from perspective of these two projects I've been working on, I'll be happy to discuss health tech innovations, both globally and in Ukraine. And I'm giving the word to Katerina.
Thank you so much. First of all, thank you for inviting me. It's a great honor for me to share my knowledge, to share my experience, and also listen to you. Great job, Yana, first of all. And my name is Katerina Potapova, as you can see. I'm neurologist, so I practice in neurologist. Also, I'm assistant professor at neurology department, Bogomolets National Medical University. And other side of my life is leading the GMK team, Global Medical Knowledge Alliance, non-profit organizations dedicated to enhance medical care in Ukraine, with focus in Ukraine. Of course, we are working worldwide, but right now all our efforts focusing here. We are making educational, scientific, and humanitarian projects, both for two sides, physician, doctors, and other healthcare workers, so different level of training, and also for patients. There are two headquarters, one in Boston, Massachusetts, United States, and also in Kyiv, Ukraine. So if we speak about our main projects, we can clusterize it up to 10 clusters. I would like to highlight several of them. So we are develop a Heal Your app. This is mobile application for peer-to-peer consultation between doctors worldwide, with focusing to help Ukrainian doctors, of course, because since the full-scale invasion has begun, doctors meet new structure of pathology. So imagine before full-scale invasion, I specialize in neuroimmunology. So I dealing with patients with multiple sclerosis, MSOD, Mogat syndrome, and others. Right now, of course, I need to help patients with traumatic brain injury, spine cord injury, and etc. And this is required additional type of knowledge. And I need to ask someone who are deeply involved of this type of pathologies. And this is why I speak about this. This is about how Heal Your app works. If you're seeking an advice from different specialties or other doctors, you can put a request in mobile app, which is free of charge. For example, in 2 clicks on your smartphone, you will receive a piece of advice, how to diagnose, how to treat, and etc. Right now, we have 95% doctors from Ukraine and 5 from United States and Europe. If you will ask why, this is because right now we have English translation, but it's not like simultaneous. That's why we are looking for AI integration to make multi-languages translation. And we want to spread this technology all over the world. But even now, if you will join our app, you will receive a great advice, and additional benefit from this platform is we are making live medical case library. So as assistant professor in neurology department, I can say to you that knowledge of student or residents, even a residence, depends on the department these people training. So to make the knowledge more consistent, you can use Heal Your app as a library to find medical case, to find diagnosis, how to diagnose and treat it. So this is one part of our job, and the other is medical educational platform, both for doctors and patients. We are translating, adapting, and publishing up-to-date articles for Ukrainian doctors, both in English and in Ukrainian. So if you, like founders, startuppers, or other related to healthcare, wanna find cutting-edge and up-to-date information in Ukrainian, you can go to gmk.org and find it. So I guess we have a discussion, so let's discuss maybe.
Yeah, so
questions.
Thank you for sharing your experience. It's really fascinating. And I thought maybe we can dive a little deeper into what are the main obstacles of adopting cutting-edge global technologies in health tech and healthcare in developing countries such as Ukraine, what are the key obstacles for Ukrainian health tech startups to integrate into the global scene, taking into consideration compliance requirement that we not always familiar with and not always adhere to here in Ukraine? What's your experience within the platform and working with the doctors? Like how flexible they are and where are we in terms of implementation of the standards of the cutting edge technologies in healthcare from the doctor's perspective?
Thank you so much for this question. Yes, obstacles about policy and compliance, of course, we meet this. And the first step that we have made when developed Heal Your app is developing rules, terms and conditions, and explanation about sensitive data and safety control policies. In our mobile app, Heal Your, only doctors. Right now, we are validating doctors by IP number if you are a doctor from United States or other European countries. And if you're from Ukraine, we request to see your diploma or license. And also, we can validate person by DIA. So we integrate DIA profile as well. And if we speak about other obstacles, I want to mention that you have to be very careful with sensitive data because, you know, sometimes where I'm searching in Instagram, for example, I see how when Ukrainian doctors who are bloggers as well publishing sensitive data. So this is like a photo of some medical reports, but if you will like zoom it, you can see the patient number or even surname and name. This is of course forbidden in normal life, yeah, we can say in other country, of course. So we need to be careful with sensitive data. In our Heal Your app, this is the rule. You can't publish anything with data. So if you will find it, the system will delete it automatically, immediately, and send a notification to users that this is forbidden by our rules. If we speak about not our experience, I also have a degree in healthcare management, and I wanna plus to your comment about nurses who not really familiar with using some digitalized tools with, that help us to collect data. Data collection in medicine in a so early stage, we can say. So if you, your work or your startup will help to improve data collection and help healthcare workers understand how to important to, first of all, design what you want to collect, then how to collect, who will collect it, and then how to analyze it. So the huge obstacle is that digital skills and digital training of healthcare workers. But this is not a problem of, I just want to mention another thing, that in our medical university, we don't have in our courses data collection training, sensitive data explanation, and others. So, of course, if you have some ideas and some projects that will help healthcare workers to be more engaged in IT processes, it will be really nice. This is the gap that you can cover.
Yes, and as well as in fintech, in health tech, access to data and working with data is a very difficult, very compliance restrictive process, right? And this is one of the reasons why we have such a huge interoperability issues in healthcare and therefore scalability issues, right? When you cannot access large data, what kind of AI can we talk about, right? AI can only grow being fed tons and tons of information, and in healthcare, information is highly fragmented, right? Every separate EHR, electronic health record, has its standard. Those standards has to speak to each other. Sometimes it's difficult to integrate. We have a similar problem in Ukraine when we are trying to match different electronic systems in Ukraine to communicate with each other, share information, match any data. We immediately face roadblocks regarding to that. We are only on our way to develop dictionaries in Ukraine that will regulate the standards, how we communicate, how we record information about certain medications, how we record information. Of course, we do use international standards for health records, but again, implementation of it is different. So still, we need from time to go through manual integrations and manual harmonizations between systems. The same is applicable to other systems. And in Ukraine, what is interesting is, unlike in developed countries, our healthcare system is 94% state-owned, right? This brings a challenge, but it also brings a huge opportunity from IT tools implementation perspective. So we do have incredible tech resources. We have incredible opportunity because it's a complete greenfield. In other countries, you need to explain why you want to remove proprietary systems. You need to remove existing players, and you need to introduce something new, which is a challenge. In Ukraine, we can introduce DIA, we can introduce eStock, eHealth, a source system, we can introduce Kyiv Цифровий, we can introduce all sorts of public services, IT services, because there was nothing before them. So we are free to implement whatever we want, and this is a great opportunity that other countries do not have. But at the same time, we have compliance challenges, right? So we need to implement them as soon as possible. In our system, eStock, the supply chain and procurement management system, we don't store any patient information. So we reduce information that we work with to the birth year and initials to be able to match certain data for end user, because sometimes doctors need to see this information when they use the system, but we do not record any specific data. And of course, when we build, we adhere to GDPR compliance. But when we speak about data recording in the private sector, I'm not very familiar how it works at the moment. And it's a big surprise to me that at high school, in universities in Ukraine, doctors do not study compliance and law with regard to sensitive data protection, health data protection. And this is something that every startup that want to work on the global arena needs to understand. It's HIPAA, first of all. It's the core of any compliance in healthcare, and it's a very detailed system that so GDPR is also required if you work in Europe, if you work in the United States. HIPAA is a must-know regulation that also explains key terms, what is sensitive information, what is personal information, what is health information, what is the difference without them. Because compliance brings also constraints in terms of how we can work with the data. We somehow need to get access to the data. To get this access, we need to have certain training, certain status, certain certification. Our legal right to work with patient data has to be established in a certain way. But also we need to be able to transform this data, to play with this data, to use it as a testing and training data set, right? So first step is always depersonalization, of course. So the good rule is always to depersonalize your data. If you work with any healthcare data set, first thing you should do is to make sure that according to HIPAA, it's depersonalized and cannot be redepersonalized, right? Because there are always ways with certain software and with certain techniques to find out personal information based even on depersonalized data. And there were examples where depersonalized data were published by governments, and then scientists were able to identify people responsible for publishing those data. For example, governors' personal information and their healthcare records, like what were their healthcare problems, when did they go to hospital, and such cases are very good examples of how we should not operate with healthcare information. And the Ukrainian ecosystem, and with this regard, gives us opportunities. So some small room for errors that we can then fix, but also we need to improve our compliance and regulation with regard to working with healthcare data, because in Ukraine we also can collect a lot of data, but for international vendors this data is not a source of information because there are lack of trust in the procedures and the ways how this data was collected, how we conduct manipulations and storage and distributions of the data. So this is something that we should do a little bit more work on.
Yeah, I want to add that you're lucky. Right now, everything is changing. So our medical education, as well as healthcare at all, in transformational process. So all of us as doctors, we are open to something new. Also in university, we in early stage of implementing these courses of methodology of research, bioethics. Of course, we have this course, but what I have, I see the difference between Ukraine and other countries. 4 months ago, I finished my clinical observership in Harvard Medical School, and the first task that I received there when I came, it was about sensitive data and depersonalization and about HIPAA. What is HIPAA and etc. And after this course, my mindset changed. And right now I teach my students that first of all, we need to be careful, even if patient, we publish something, for example, in Instagram, even patient, it's depersonalized the case about man come to me and I treat blah, blah, blah. If this person can identify this is about him, this is forbidden. HIPAA also teach us that patient have to be in a safe place in hospital. That's why we need to, as a physician, be very careful. And for founders, startuppers, and other entrepreneurs in healthcare sector, you're really lucky. Right now, you can change everything. Rules are changing, and this is a perfect time to make a difference in the healthcare sector. And also have a comment about AI. If here are some startuppers who have ideas about AI transformation from the voice to text, come to Bogomolets National Medical University, or I'm also working in hospitals of internal affairs. We are open to this because a lot of medical data we do not fill out the system because we have no time. And when we are speaking with a patient during the consultation, it will be perfect to have AI tool in a smartphone that will summarize the patient history, and this will lead to enhance medical care. If you will ask how, because we can see patient eyes, not to type in every time. Imagine, so like 80% of our work, it's about drafting and writing medical history. And this is really helpful for us if you will make some tools that will help with medical records.
That's actually a very interesting insight as well, Katerina, and thank you for that. I wanted to mention that there's still existing resistance on the side of doctors to use AI, of course, we need to focus on safety-focused LLMs, right? So the biggest growth in AI in healthcare is in LLMs, right? This is what we do to reduce burden for the doctors, to make notes, to summarize the notes, to develop bots that can help with all sorts of communication and primary data collection from the patients, and a little bit less of what we've seen back in 2015-16 when we were working more on image-related artificial intelligence. For example, to be able to identify cancer cells with machine learning. So back then, doctors were highly resistant to experiment with any sort of AI tools. There was a sort of attitude that, of course, no machine can substitute my expertise sort of reaction. And our clients were always communicating that, okay, it's a support tool. Of course, it will not substitute anybody. It will be your assistant, your helper. And what today we see is, of course, we start with what is less risky, everything related to recording patients' data, to summarize notes, etc., and less diagnostics, right? So the big concept is safety-focused LLMs that have additional layers of security, of expertise, audits, of testing, and to be able to prove that your ML is trained on a specific data set. So you have layers of confirmation that there will be no false positive, which is very a sensitive topic in healthcare. But now we see openness on the side of the doctors, as you say. So maybe from your perspective, what are still the roadblocks and problems of implementing AI in healthcare in terms of collaboration between doctors and technologists, between doctors and health tech, and between also academia and health tech? How to establish this collaboration and to make it more productive from your perspective?
Yeah, thank you for this question. So first of all, the first obstacle is IT sector live in their bubble and medicine in their bubble. And sometimes we need to make these bridges like this one. So I'm so thankful to SET University that we are right now sitting here together. Because we need to have these bridges where doctors can ask questions to AI companies, to providers, to other related organizations, and back and forth, yeah, so they can have a dialogue. And also bureaucratic process, of course. For example, in our university, it depends to whom you will write an email, yes, so it really depends on. But I guess in the different fields the same. So if you join such kind of events, go to accelerators or other events, you can meet new persons, expands your network and make new collaboration. For example, in GMK, Global Medical Knowledge Alliance, as I mentioned before, we make a community of physicians all over the world, so mostly from United States in Ukraine. But if you need something, you can write to us and we'll connect you with different hospitals, institutions, other scientists all over the world. Because, especially in Ukraine, if, for example, some organization asks us to just make a connection, we will do this. Why? Because it's related to our mission to enhance medical care. If your startup will help patients, of course, we will connect you with with our network, our experts, our institution, and etc. So, and be if you did not receive a reply from the first time, write another email. So have a discipline and be consistent on your goal. If you need something from the institution or hospital, just write to them. And what else? I guess that's all from my perspective. And I guess social media also a great tool for you. If you need to find someone, you can just write to people. And you know, I have 8-year experience with 8 years as a leader of global sales in medical tourism company, Bookimed.com, and their CEO one day said to me that, Katya, you can write everybody in the world. And sometimes these people can reply to you. And you know, I like this statement because after this conversation, believe me, I wrote to Elon Musk, to presidents, and etc. And right now, I have some projects that I would not have if I scared to write. That's why this is from my perspective. Just do it.
That's actually great, and I hope that despite the difficult situation in Ukraine right now, we can also leverage this and get access to more expertise, to better resources, form stronger connections globally. And I wanted to speak a little bit about the war-torn areas and national health tech solutions, both private and public, that help to increase resistance and to grow crisis management solutions in healthcare for hospitals and war-torn areas. What can we do there? What is already done? What challenges hospitals are facing? So from my perspective, there were a lot of funding and a lot of opportunities, both to get expertise from doctors worldwide, but also to build IT tools to monitor like technical situation in every hospital. Equipment, do they have power generators? Do they have bomb shelters? How is it financed? Today we already have systems that helps to monitor each hospital and understand what it has been done and not, and to direct resources there to fix the problems. We have solutions to quickly distribute and redistribute humanitarian aid in a transparent way. This is something that today is already other countries asking for to be used in other regions, because we see what's going on in the world. We see that emergency response functionalities is something that more and more countries are in need of. And at the same time, we need a lot of training for hospital staff. Our hospitals are understaffed tremendously. We do have beautiful IT systems, but sometimes we don't have computers, which doesn't work together very well. What is your perspective with working with doctors, like on your platform? Do you have a lot of doctors from war-torn zones? How do they communicate? What they use? Like, what is their situation, and what are the main questions that they are directing to experts abroad? Like, what kind of problems do they bring to your platform?
Thank you so much for this question. There are a lot of problems that our frontline doctors see right now, and we are trying to help them a little bit. So let's start from the very beginning, from my first statement about that war and full-scale invasion has changed structure of pathology and also number of healthcare workers who are currently working here in Ukraine. So imagine numbers of patients increased twicely, or I don't know the exact statistics, but the numbers increased, and the numbers of doctors who relocated during internally in Ukraine and also relocated to other countries also increased. That's why we see this gap. For one doctor, we have a lot of numbers of cases with pathology that these doctors have never seen and need to ask other specialty. So Heal Your app help this physician to find an answer much more easily, and this is our help to these doctors. And also we are providing trainings, webinars, teletrainings with physician to upskill them in neurosurgery, in neurology, in trauma. Also, we have really success case with ATLS, Advanced Trauma Life Support. This is guideline how the best world practice how to deal with traumatic diseases, traumatic patients, and our GMK team translated, adapted this guideline to Ukrainian reality, and with Nash Format publisher published it. And we disseminate this book, a printed book, free of charge to frontline doctors or who are dealing with diseases like traumatic brain injury, spine injury, and other related to war. And also we have online, free of charge PDF of this translated ATLS that we publish in our gmk.org, so everybody can download it and use it. If you will ask why you translated it, if it's like open sources information in English, because we also have a problem with English proficiency among healthcare workers. It depends, of course, from the region. In Kyiv, for example, the percentage of doctors who are speaking English will be higher. But if we speak about frontline region, they have no time to read in English. They need in Ukrainian, in book, that they can open and use it. Yes, and just come to my mind, I'm sorry, about obstacles. Sometimes digital solution like eHealth, this is a terrific tool. I'm ambassador of digitalization of everything in healthcare. But imagine you have our doctors workload of our doctors, they are overloaded. They have no time for additional forms and etc. And if we use like American standards and American approach how to integrate electronic medical system, they have additional personnel for this. For example, administrator or other assistant who will fill out this form for you. In Ukraine, doctors are managers, also salesperson, also administrator, and etc., etc., etc. So if your startup is about additional form, just think about who will fill out this form. That's why doctors sometimes say, "Oh, don't ask me to do this. I don't have a time." So keep in mind, if your solution will shorten the time that the doctor will waste for medical record, this is a great startup. This is from a physician perspective. And also, if we being back to your question about our work that help our doctors in order, if we speak about wartime condition, we also have observership program. So more than 51 doctors right now from different specialization. There are 12 specialization related to war that had clinical observership in the best medical schools and rehabilitation centers and hospitals in United States. So time to time we are open a call like for the best doctors who can go there. The main criteria how we choose these doctors is these doctors not only will gain new information and become more experienced and skilled doctor, this person have to come back to Ukraine and disseminate this information and become trainer for trainees. Yes, so and others project that we published in our site, I guess, To make long story short, you can go to our website and see other projects and information.
Thank you. That's actually very valuable. I totally agree that when we implement national digital system, the huge burden for doctors is to insert more and more information. For example, when we implement eStock, the system I was talking about, we see already that there are like 4 other existing systems that doctors need to interact with on a daily basis. Like they insert information in our system, then they go to eHealth and they insert information there. And there are 3 other systems. So, and there is a doctor who has to do it by him or herself, no assistant personnel. And this is why when we design the business process for what we do, we try to have a single data source into the system that we can further reuse for all other processing, and don't create any additional manual work for hospitals personnel. But of course it's on the way, and of course it's very difficult. And the sad reality is that unless we create legal framework and regulatory requirements to fill in any information, nothing is filled in, and therefore to implement the process, to explain to people how to use the system, what is the benefit of it. We need a lot of training and communication, and this is what we do as well. So on the one side, it's technical development, but on the other side, it's like 50% is communication. At this point, I think we covered all the topics we wanted to speak about, but we are open to the questions from the audience, or if you guys have any stories of your own to share with regard to what we just spoke about.
Yeah, we have only one hand, so a short question from you, please. 1 second.
Hi, everybody. Thank you for your talks. Very interesting. What do you think about doctor assistant? Like new specialist?
Are you waiting for this person? In United States, there are additional specialization doctor assistant. It's this person can also diagnose patient, treat patient for some diseases. Yes, we have no such kind of person, and I don't think that in near future we will have. But if hospitals or government will add additional like assistant, not like doctor assistant for the department, it will be it will be crucial benefit for this department, because besides the medical recourse, we also have a lot of other administrative stuff that we need to also cover.
Thank you, Katerina, for your answers. Thank you again, and thank you, of course, Yana. Let's applause to our amazing speakers. We will, of course, have a short break for networking and the main networking part to have a great conversation behind. And yeah, we're ready to continue. Thank you. While our help team support me and bring off these chairs and the table, yes, thank you. Thank you very much. So we are ready to continue, and before we'll have and super interesting block of our pitch time, I want to bring you more insights about actually Generation H program, because I know that all of you guys who are with us today, some of you know about that from very beginning and even took part in it, but someone not. And our online audience, not everyone know about the history of it and why we started actually. Because at the behind the scene, as I say, we have of course some challenges. Not only me or SAT University, but I am talking about the health tech industry at all. And we're talking not only about the Ukrainian region, but of course CE region. And for all these industry, we just identify the main popular challenges that we'll have before we start and generate our Generation H initiative. Of course, we're talking about some issues in collaboration and connection. And I mean not only of the teammates who are not so trustful, and before that at Fireside Chat, we're talking a little bit about the trustee between scientists or academia and these tech entrepreneurs. And that's this part. Of course, I want to highlight those entrepreneurs in health tech who are bringing in their products or services. One of the main challenges, of course, they are scaling abroad, scaling to the new regions and new markets. And of course, we are talking about the huge part that we are just described a little bit too at our Fireside Chat about some issues in the risk area and some regulation. So, of course, it's not the full list of these challenges, but the main part of it. So we bring it together and think what we can do for Ukrainian actually. And for Ukrainians, we decided to bring this initiative and divide it to the two parts. For the ideathon, for those who want to start this way in health tech and bring their expertise to build something, to start this way. And that's why we built this platform on Ideathon 5 days with those who are academia, scientists, researchers, doctors, of course, and those tech entrepreneurs who want to start their own projects. And the boot camp, the second part, where we are talking about the existing startups, existing products who are already operating in Ukraine and has its own traction and so on and so forth. And these two parts engaged you guys today here. Of course, we are bringing some benefits, and we bring much more benefits that you see at this slide, of course. We're starting from ideas and go into the existing products. That's why it's about the community that I'm talking about here time and again. Because this community that we built for health tech, it's not only about these pilots or about this year, it's about long term. Because these guys who are bringing in their ideas, who are bringing their great minds, they had an access to each other. They had this contribution to each other, and that the impact. And we are, of course, trying to measure it by a short term for this moment, but month by month, year by year, I hope that we just growing and growing this community. So, a little bit results in numbers that we have. 5-day ideathon, 2-week boot camp, 100,000 people coverage for this initiative and interests, not only those who are offline, but online too. And of course, we have more than 100 applicants for both sides of this initiative. And we have 13 finalists. That's the teams that you heard and see today. And before we start this speech time, of course, I want to introduce you those who will judge them. Yeah, of course, we have judges and we have jury members. So, dear jury members, I want to bring you to the first row. You have brochures with the evaluation and scoring cards. So while I will introduce you, I suppose that you're, yes, you are here. Anastasia Deva, CEO of Tokarev Foundation, whom you already know, guys. Valeria Katris from Horizon Capital. And Volodymyr Nerubenko. Actually, Volodymyr is a co-founder of health tech startups, Lab24, of course, and TerraLab as a company. And as he say by his own, I'm a serial entrepreneur, actually. And that's true, but you have a successful background on it. And we're also waiting for Petro Soviak from Vesna Capital, but I suppose that we have some issues with our corks on the roads. Dear jury members, dear guests who are listening and see us online, we have, of course, some rules, I mean, a little bit rules, for our pitchers. Because the team, every team, will have only 3 minutes per pitch. And we have also limited time for the questions from our jury members. We also have 3 minutes for jury members. The evaluation will be step by step, and then in the end of today's evening, we're just talk about the team who will have this grant. But it will be further. So I want to start, and I want to bring to this stage the first team that will present their product. It will be Oval, Igor Kovalenko.
Hello, everyone. Nice to meet you. Oh, yeah, now it's better. Nice to meet you. And it's really exciting to open our pitch session. And I would like to present world's first saliva-based fertility tracker. My name is Igor. I'm co-founder and CTO at Oval, where we are empowering women with AI-driven insights. Our journey began with a personal challenge. Sergey, our CEO, and his wife were trying to conceive their 3rd child. And one day, in frustration, he turned to me and asked, Igor, can we create a small, inexpensive microscope to track ovulation at home? And I said, surely yes. And this question sparked our mission. Current solutions for at-home fertility tracking are outdated, messy, and requires privacy. That's why millions of women are disappointed in their tries to track hormonal health. Ovulation tracking with Oval looks like that. Just open the device, put small drop of saliva right here, and close the device. And that's it. You will get results in a minute in your mobile phone. Oval is a groundbreaking solution. This is a tiny digital microscope which takes high-resolution photos and sends it to the cloud, where our AI interprets the results and provides results directly to customers' phone. No refills, fast and accurate solution for at-home ovulation tracking. What else making us truly unique is the data. We're only the one company in the world who takes thousands of photos of dried saliva. More data we collect, more correlation we see. And now we see that fertility is just the beginning. Hormonal diagnostics markets are growing rapidly, and Oval are ready to lead this evolution. We believe that Oval can become a lifestyle partner for all women, from first period till menopause. To succeed, we have best ever team. Everybody you see here are coming from world-leading companies, and of course I can talk a lot about team, but the most important thing you should know about us that we are ready to drive the change, and we know how. Now we are raising 3 million seed round, and we already have half of that. And we are looking for lead investor. Our main goal for next year is to sell 6,000 ovals in US market. At Oval, we are doing really amazing things. I'm proud to share that Oval is already helped 3 families to get pregnant. And I would say even more. My family, my wife and I, we are waiting for our second baby thanks to that purple little miracle. Thank you for your attention. Yeah, and today you have a chance to join us in our amazing journey. Maybe you have some questions? Nope. No, but I can hear you. You can ask action.
Here. Great pitch, thank you. Tell us more about your business model right now.
Could you please return to our presentation, because I have some slides for that. Yeah, we have different business models. Depends on what we want to sell, because now we have a few different types. But the main numbers you can see here. It's average selling price for device. It's 198. And monthly subscription is for unlimited testing is 9.99. So we're targeting, as you can see, 55 million women, and our current target a little bit lower, because now current focus is only fertility, but we have a plan, we have a vision that, as I said, Oval can be a lifestyle partner. So we want to extend our target market to pregnancy, contraception, and even more. Now we have clinical trials where we are where we are improving that our device can track not only estrogen, but also and progesterone. This will open many doors for us. Also menopause, also IVF, and so on. So it's really perspective product, and yeah, I would share this information with you and my happiness.
One more short question. How big is your MRI right now?
Sales is not our focus right now, because our main goal is to get as much data as we can right now, to collect this data and analyze and train our AI data sets and our AI models. And after that, we will focus on selling and for all this stuff with markets, actually, because now we have only trials sales, and we just check what is the market and marketing model will work better for our product, actually.
Okay, thank you.
One, two, three. Okay. Thank you for your pitch. Actually, you have a really nice product. I love it, how it looks. Yeah.
You can touch it. It's real. It's serial product, so you can touch it. You can buy it even.
Wow. So my question is actually, I have several questions. The first one is the accuracy, because as far as I know, the women's cycle is usually tracked not by saliva but by blood or some other things. So, like, why this should work, and what is the accuracy? And the second one is, should I clean it, and how often? And
okay, answer for your first question. First of all, thank you for those questions. It's really interesting, and again, I need my presentation, if you don't mind. Yeah, we first of all, I would say that we didn't provide this method. It's almost 1 century old product, 1 century old method, but covered with AI and with convenient hardware. So this method is well known by scientists, and we know that this method is working with high accuracy, and we already done with first trial, clinical trial, and as you can see, these high numbers, we proved that our device work as the same accuracy that this method itself. So we have 42 participants. We did this clinical trial in Ukraine. So I think these numbers is pretty self-explaining, actually. It's really high accuracy. And the second question about how often you should clean it. And yes, this is a good question.
And does it influence the result, actually?
Yes, of course, as usual in medical device. So you need to clean it before each and every use. But you can use anything that you want. You can use towel, you can use some paper, you can use even part of your wearing and so on. So as you probably see, this is the small object glass. It's easy to clean, and we also provide in the box. I can also show the box. It's, as I said, it's serial product. So we have that here, and we have this beautiful punch, and we also provide this small towel with our logo.
No, it looks amazing.
So you can use it, and but yeah, you should clean it before and every use.
Thanks.
Any other questions? No? No?
I think no. Thank you. Thank you, Igor.
Thank you very much for your attention.
Petro, can I ask you to go to the first row? Thank you very much. So, we're ready to continue, and the next startup will be Karen24. So, welcoming Hosha Akimov and their project.
Hello, everyone, and thank you for this opportunity to present you Karen24. It's a comprehensive support platform for cancer patients and their families during treatment. Okay. The idea comes from my personal experience of caring for several relatives with cancer. All my family members on this photo had this diagnosis, so I've seen firsthand how overwhelming cancer treatment could be without right knowledge, support, and tools. And this is value we create at Karen24. It's an application for daily support patients' entire family, thanks to which users have a clear plan of action, information about the disease, and psychological support. We held more than 300 meetings with stakeholders in UK and US. We keep doing it, but also at the same time, we worked hard at Ukraine here, and we saw a great impact that our team was already making here. So now we decide to focus on our home market because, you know, in other countries, they already have different services for patients. In Ukraine, in country when we have more than 1 million people with history of cancer, we don't have direct competitors. It's sad. So we are really motivated to fix it. We launched application 4 months ago in collaboration with National Cancer Institute. Today we have actually 4,000 active users and 4 providers, including the biggest pharmacy chain. I don't know why we have these problems with my slides. It was okay just 2 hours ago, but doesn't matter. Our biggest challenge today on our market is to find sustainable business model And we testing different approaches and calculating the numbers. First source is affiliate marketing. Second source is B2B sales, when in addition to product itself, we also compete for PR and HR budgets. These numbers we're really proud of. I guess we have the cheapest customer acquisition cost on the market. Thankful to our network with healthcare administrations, with physicians and patient organizations. And our final goal here is providing service to every new cancer patients in Ukraine. So support, no. Our team. Our team combines expertise in oncology, psychology, and healthcare technology. As caregivers and cancer survivors ourselves, we bring both professional excellence and personal commitment to transforming cancer treatment support. So support Caring24 and help us improve cancer care by giving patients the help they need. Thank you.
And please, thank you. Turn on my micro. Do we have any questions from jury members? No. No.
Can you elaborate a little? Thank you so much. It was great, and I really appreciate the diversity of your team, because I believe that in health tech, the inclusion of the representatives who survived cancer or who represent, I would say, medical staff, it's extremely important. Thank you. The great job and great journey. Can you elaborate a little bit more on business model once again? You had the slide, but can you tell how it works?
First of all, affiliate marketing, when we gain fee for implementation or for some when people buy some stuff, some goods for patients or some service for patients, we gain a little fee for it. Second, B2B sales, when we don't even bring our solution to employees. We work with HR paying what we should to do when our company we have someone with cancer diagnosis, or maybe some family member has this diagnosis, how we need to communicate these people. We built like protocol to companies thanks to our main product and give them the support they need on this journey. So employees are okay with this, something like that.
Can you, thank you so much. Can you say once again, Caring24, what is the big dream of Caring24? Taking into consideration Ukraine or world, like what
I wanna that every person who get cancer diagnosis know that all he need right now install our application and have all support he need on this journey, on treatment journey, from diagnosis to the end of treatment.
Yeah,
Thank you for your attention.
I'm sorry, one more question. Maybe I will bring you back to the first slides, but still I have to ask. What are the core features of your app actually? Is it the task manager or it is the access to some specialist? What is inside?
Yeah, we start like mental health solution. Now we're...
What is it? What is a mental health solution?
It's expertise with oncopsychologist, session with oncopsychologist. You also support chat through application.
Okay. And what's next? Like what you start with?
Next, it's management around treatment, where I can have second opinion, where I can buy medications. Also, we have features to help people monitoring their medications, because this is a problem after chemo, for example, when people they forget their names, not only medication.
Okay, thank you.
Thank you very much.
Thank you.
So we're going to the next startup. It will be the Players Get Ready, and I'm welcoming to this stage and the founder of the Players Get Ready, Solomia.
That's not me. Okay, let's just wait. Okay, so I would like you to answer the question, who is the most important person in your life? How long has it been since you told this person how you truly feel, what you need, and what you are going through? If you already unpacked our present, you are holding a tool that can help you do that today. This is one of card games developed by a psychotherapist to spark meaningful conversation and foster emotional closeness. All of these games are also available online. All of this is a part of Players Get Ready, a brand I founded in 2021. Today, I would like to share with you why we need to create an app and scale our project. Without any external funding, we've gathered nearly 100,000 players, over 50,000 social media followers, and dedicated community of fans in Ukraine. How did we achieve this? We provide an easy-to-use but professional tool that addresses growing global pandemic recognized by World Health Organization: loneliness. Loneliness isn't just about social isolation. It's about lack of emotional closeness between people who should be closest to us: our parents, friends, family. Among 30% of adults globally experience loneliness. We are not alone in a fight against loneliness with card games, but we provide digital tool with added features that build trust and emotional intimacy. Our approach is unique. We know how to put our users' needs first, and they love it. We've seen strong interest in psychological game apps, especially in the UK market, where we see over 3 million potential users. Our goal is to create an app with such games for the British market. If we get just 5% of our potential British users, we can generate from 10 to 12 million pounds in revenue. To validate the interest in British market, we've launched crowdfunding program just 3 days ago, and we have already received support from our initial community. Our Ukrainian tractions show that more than 95% of online game players would love to recommend it to others, with CLV 4 times higher than our SaaS. This is our team ready to bring this project to life. With $250,000 investment, we plan to launch the app in UK market in 6 months, and in next 6 months, we're going to diversify our revenue streams based on first 50,000 subscribers. Without any support, we'll still go forward, but it will take 3 years instead of 1. Thank you. I'm ready to answer your questions.
Hi, thank you for your pitch. Actually, I have a nice story that exactly 2 weeks ago I was playing your game with my boyfriend, and it was very nice. So I definitely can recommend it to everyone here.
Thank you.
Yeah, but still the market for such games is very crowded, and I wonder how hard it will be for you to compete with other online games and such mental games. What do you think about it? Can you please elaborate more?
Yeah, well, you see, I am I know how to build the trust with people who are reading our content in social media. This is the first breakpoint for me to stay connected with people, because I'm truly in these things with, head off. But in Ukraine, we definitely did this very successfully. We really have a community of fans of our brand, and a lot of people are playing our games, especially in last 6 months, just because we did that for previous 2, maybe 3 years. So I think that we can scale this method of loving the brand and then selling the product. I would love to try this model not just in Ukraine, but in other markets.
It's a great job. Can you tell more about your team?
Yes, sure. So the main team in Ukraine is about marketing and sales, but we also have our MVP product. I showed it before, and the tech team is ready to work with app. It's a developer, a QA tester who can help us in long term, and a designer that can develop. Design an app. So these 3 people is our tech team, and me, my colleague Anna, psychotherapist Yulia. We are, working on everything else over this project.
And what is the main background of you and your core team?
Me as a person?
Yeah.
I'm a marketologist and entrepreneur.
But you also have a psychologist in the team. That's great. Who are your main competitors?
Well, globally, we are not really strangers. It's quite a big and, just an amazing brand. I'm definitely a fan of their brand. By that, they have no digital tool. So it's just physical card games. And they are not in British market physically, so you can order and get it in 3 weeks or when it will go from US to you. So, and also in every other digital solution that we have in the list of our competitors, they are staying is in very small and, I would say, it is small marketing strategies. They don't talk to everybody. They don't understand that they are working with loneliness as a problem. And that is why they are staying like a niche tool to a leisure time with your loved ones when you don't know what to do and you don't want to watch the movie. But it's not the problem we are solving, and I don't see that these apps are recognizing and understanding it. Thank you.
And the last short question from Petro.
Hi. Could you go over the business model again? And give the details, please. The lifetime of the customers and so on. Because with the cards, it's relatively easy. You buy a set, if you like it, you play it. You could play it for years, right?
Yeah.
With the app, how does it work? Do you pay subscription, or is it a one-time purchase? And what's your expectation about how long people will gonna stick to certain games and so on?
Well, okay. So first of all, at this moment, it is one purchase per game in our MVP project. And the game in Ukraine costs $9.9 for online game, 150 cards. If we talk about small game, is $7.6. And you have lifetime access to this game on our closed website. So the numbers you've seen, it's about this. And the product is for different social roles. So you can play with your wife or girlfriend, you can play with your parents, you can play with your friends. All of it is different games. So we are selling after selling the first game, we are usually selling 3 or 4 more, 4 different social roles and spending time with different people. That is why we've decided that app is necessary, because, you know, you just going back to this product from time to time when you're on the road, when you don't want to do whatever you used to do in the Friday evenings, when you have birthday party. Also, we use, and I didn't mention that because I had just 3 minutes, but we have a game for everybody. It's a game that help to bring new social connections. So when people are, you know, that moment when you have guests from different groups of your friends, and you don't know what you should talk about, you can get this game, and everybody answering the question will talk about themselves. So you don't need to have previously built social connections. Me and you at this moment can play this game easily. It's a game for everybody. So yeah, we cover really different social situations. That's why people used to be back to the product, and subscription base is, you know, just seems to be разумно для нас. I'm sorry, I'm just tired to think in English.
It's okay, thank you. I think you have a lot of thinking to do about the business model, but for now it's okay. Do you have time for one more? No? No.
No.
I think we can chat later on the pause if it's okay.
Or even do that at this short break. Of course, yes. Thank you, Salomia. So we are strictly in time, and I want to introduce you the next startup, Careway, and its founder, Igor Rastrepin.
Hi. It's me and my wife. I have any notes about your question. Sorry. I'm Igor, CEO of Careway, and this is my story. When my wife and I stayed at that pregnancy test, those 2 lines weren't just a sign of joy. They were a reminder of the uncertainty and challenges ahead. In that moment, Careway was born, an app to help couples face the emotional and practical journey to parenthood. However, my story is not only one. 200,000 couples face reproductive challenges every year. 67% of couples feel unsupported and lost on their journey to parenthood. Uncertainty in choosing a doctor. 30% of couples don't know where to turn. Sensitive topic. 23% of women conception challenges suffer from depression. But there is a solution. One app for comprehensive support. We provide personalized doctor recommendation and scheduling, support 24/7 support for both partners through an AI assistant, and advanced tool for monitoring of physical and mental health. Careway builds an ecosystem that naturally connects couples with the right care in each stage. We use AI, personalization, and digital tools to make these connections seamless and timely. While others offer fragmented solutions, separate booking apps, clinic services, and support platforms, we create one seamless platform. One seamless journey, sorry. Femtech is an $8 billion global market. In Ukraine, we target the 60 million private pregnancy care segment, where we've already validated our model with 80 partner clinics. We'll earn 50% commission per patient plus $10 monthly premium subscription. In our first year, we built AI platform and expand to 100 prenatal care clinics. With proven technology and established presence, well accelerates growth nationwide. We are raising 250,000 euros with clear allocation, mainly product development and marketing, to raise 5,500 users. We'll become profitable in 10 months and few further growth with revenue. Our team combines in healthcare, business, and technology to create our solution. Having a baby is more than medical care. It's a little journey that needs the right support. We know how to make it joyful. Let's connect. Thank you.
Let me start this time. Igor, thank you. So the key question I have is, what makes you think that putting all of those services in one app makes sense?
I think it's... Я маю досвід побудови сервісу для супровіду людей, які записуються на перший чекап. І з досвіду 5-річного цього сервісу розумію, що є певні люди, яким недостатньо того, що вони можуть знайти через власні канали. Їх цікавить власне комплексна підтримка у питаннях, як до кого звернутись, і суміжних питаннях, бо є певний досвід, коли після звернення в клініку звертаються знову до нас по тих питаннях, в яких не допоміг лікар чи заклад. На власному досвіді я розумію, з чим стикається вагітна жінка, і не тільки вагітна жінка, а саме пара. І таких історій біля мене і коло моїх тіммейтів достатньо багато. Також ми отримали зворотній зв'язок від лікарів, що займаються веденням вагітності, або гінекологів. І тому вважаємо, що саме комплексна підтримка, вона потрібна і вона можлива. На сьогодні її ніхто саме так в Україні не впроваджує і не надає, окрім преміум пологових будинків. А ми розуміємо, як це зробити. Як це зробити недорого і якісно.
Дякую. Тоді швидке наступне питання. Ваш цільовий клієнт – це людина, якій потрібна комплексна підтримка, от саме всі чи більшість цих сфер, чи хоча б 1, 2, 3?
Наш цільовий клієнт, який хоче брати свого лікаря для ведення вагітності не через холодні досьє в інтернеті, а отримати певну допомогу експерта, який розуміється не тільки на цьому кроці, а на наступних. Наш онбординг через експертизу, через залучення пацієнта, клієнта до загальної історії і розуміння того вибору, що він робить разом з нами.
Дякую. І можна ще раз на прикладі якогось ринку, який вам найбільш зрозумілий, мабуть, український, про яку частку ринку ви говорите? Тобто, хто ці цільові користувачі, скільки вони складають? Там 10, 20, 50%?
Саме щодо нашої цільової аудиторії, жінок?
Ваша цільова аудиторія там з усієї кількості жінок, які намагаються завагітніти? Скільки це?
Протягом року ми бачимо десь 37 тисяч жінок, які або планують вагітність, або знаходяться у стадії вагітності. І з цих 37 тисяч ми плануємо 5 тисяч залучити вже протягом першого року. Стоп. 37 тисяч жінок репродуктивного віку, які цікавить вагітність, що звертаються до приватних закладів. Це частка не більше, ніж 20% від загальної кількості жінок.
Добре, зрозумів. Дякую.
Дякую. Дякуємо, Ігоре. So you can leave it here. So, thank you again, Igor, and thank you for the presentation of Caraway. And I want to introduce you the next feature and their startup ApexMed. And welcome to the stage. You can have a look.
Hi, I'm Eugene. I'm founder of ApexMed, a virtual assistant for personalized disease treatment. The health of each of us depends on millions of factors and individual characteristics that we must consider. But the modern healthcare systems takes only a small fraction of these into account, leading to ineffective treatment and usage, irrelevant or even harmful medical practice. To overcome this issue, we built a tool that analyzes your current treatment plan, based on your health records, genetic profile, and large-scale medical data. We offer our tool as integration with existing medical information system, where end user receive health insight, a report, which highlights key information about disease, taking medication, interaction with genetic data, and provides warnings and recommendations for further treatment. Our key benefit is that ApexMed reduces drug inefficiency up to 30% by reducing chance of side effect, and reduces time needed for hospital to treat one patient up to 40%. We operate in e-health market, and our destination point is US market, which is estimated about $350 billion of US dollars. And our starting point is Ukraine, which is estimated about $2 million of dollars. There are a lot of competitors on the market, but our main advantage is that we use a comprehensive approach to analyze the whole patient data, not only some of its parts. We already conducted more than 10 pilots, and our tool was used by more than 7,000 of patients, and we have now MRR about $4K of US dollars. Now we are finishing pilots in Ukraine and our ongoing integrations, and in our plans, we want to end up the next year by piloting in US market. The funds we aim to raise will go on R&D our existing technical tool and acquiring new B2B clients. We have specialists in software development, specialists in developing intellectual system, specialists in genetics, bioinformatics, and medicine. So personalized treatment starts with ApexMed. Thank you.
Can I start? Okay, I'll start again. So how does this match with prescription medicine when your doctor prescribes you something, right, the medicine, and you have to stick to the prescription?
Yes, our tool is like helping hand for doctors. So doctors already diagnose and prescribe some treatment for patient, and he can use our tool to validate his own decision. Does his decision contain some risks for health of patient?
Okay, so it's B2B then?
It's B2B, yes.
But at the end, you've mentioned you have some number of users who are patients?
Yeah.
So that
I told that more than 7,000 of patients used our tool, but we have only B2B clients.
Okay, then how could patients use your tool if it's B2B?
I mean patient data that were analyzed.
Okay. Thank you.
May I ask with whom you've already worked? Who was the pilot facilities or businesses with whom you've already collected this data and analyzed it?
We worked with several hospitals in Ukraine, in general in Volyn region. But now our main client, we have only one client that pays to us money, is actually genetic laboratory, but we still piloting in Ukrainian hospitals.
And if I would ask, like, tell me in 3 words, what is your business about? How would you describe it? What are the main ключові слова? Like keywords of your business?
Keywords. We provide personalized approach for patient. Use not only protocols to treat and prescribe some medications, but his personal information, his certain personal medical states, his DNA.
And innovation is that it also includes some aspects of genetics, DNA, right, from the labs, or?
Yes, the innovation is that we combine DNA of patient and his medical history and provides, based on that information, some highlights about his further treatment.
Mm-hmm. Thank you.
Okay, one more question. DNA got me thinking. How is DNA plays into all of this? Because usually the meds are not tagged to certain DNA, right? It's for everyone. So my DNA or his DNA or her DNA doesn't really matter. I mean, we could be prescribed the medicine. So why does it make any sense?
You're just wrong. Because if you...
No, look, say I have a pain. The doctor prescribed me ibuprofen, right? It's not DNA linked somehow. I mean...
It's completely linked to DNA because a doctor can prescribe you different active substances, different medications. But some of these medications won't affect you because of your certain DNA alleles.
Okay, that's...
And there are a lot of medications, for example, for very complex chronic conditions such as cancer or cardiovascular diseases that are very expensive and have high possibility to have zero impact on you.
Okay.
Without DNA testing.
Okay, you take me to my next question. Do you focus on any medical areas, like cancer treatment, I don't know?
Yes, we are focusing on heart-related diseases.
Okay, and those things are genetically connected?
Yes,
okay.
Yes, it's like a strange question because each medications that exist in our world have like chance won't affect you because of your genetics.
Okay.
So there are statistics, for example, the very common medications such as aspirin, it has 60% possibility to work on you.
Okay.
And 40% does not do anything. So each medications have such possibility, a dependency of your genetics.
So that's new information for me, and if I'm an average person, you should start with that, saying like medicine only works in X%, like on...
Actually, there are a lot of doctors who doesn't know it.
That's a good way to pitch. Thank you.
So we are wrong people, we are average people, we really need to understand with very simple words. And what I'm trying to also ask is, what is your big dream? Like, why EpicsMed should exist? Like, what global problem it solves? Like, why?
Our big dream is to be integrated in the decision-making process for patient treatment. So now doctors don't use any kind of tools, such as EpicsMed. And our general goal is to inject our solution in whole decision-making process.
What impact for humanity will it have?
It decreases, it improves efficiency of drugs, because when you take some drugs, it has chance to have zero effect on you. And you take another one. We are reducing this possibility and trying to make medication works from first intaking. So our goal is to improve drug efficiency and reduce mistakes during treatment.
Beautiful. Zhenya, do you understand why I ask this question, why we ask these questions? And what kind of storytelling you can integrate in the future?
Yeah.
Good. Thank you.
That's all. Thank you very much. Yes, dear founders, it's not so easy to answer the jury's question. It's not only about the business model or things so. I want to introduce you the next startup, and after that we will have a short coffee break between the next cohort and keynote speech. So I'm welcoming to this stage Anna Chorna from Mindship. Anna.
Okay, let's start again. When was the last time you felt stressed? 8 of 10 people, including me, and most probably you, feel regular stress. And it's even higher for Gen Z and millennials. Let me tell you the story of my co-founder, Slava. Like many Gen Z, his girlfriend faced intense work stress that led to an anxiety disorder. She looked for ways to feel better and found relief via professional help and breath work. Many people, especially the younger generation, struggle with stress and anxiety, leading to trillion in lost productivity, 91,000 the cost of stress for a 100-person company. What if you had a personalized assistant knowing exactly what works for you to quickly manage stress and anxiety? The good news, the latest research says that the medical research says that breath work boosts mood and energy and proven even more effective than mindfulness meditations. And it's obvious that employee mental health impact the success of your business. All of this inspired us to create Mindship. We combine science, your data, and AI to provide tailored breathing practices to manage stress, anxiety, or boost focus in minutes. How it works? By sharing how you feel and what you would like to achieve, our AI analyzing your wellness data, like sleep and activity level, and breathing patterns. And just in seconds, you receive tailored breathing practice that suits you best. All breathing practices recommended by our AI are carefully selected by breathing therapists. Every month, millions of users look for solutions to the issue we address. Meanwhile, the digital well-being market is growing fast, and the younger generation looking for science-based, hyper-personal health and wellness solutions. All of this and our approach helping us to build the future of data-driven well-being. We are launching on key platforms and using subscription model. And a part of our big plans, we aim to create simple yet effective way to restore balance, exactly when you need it most. Just in 2 months, we received a lot of positive feedback, 3 LOIs signed, and the growing waiting list. With the expertise in mobile development, AI, marketing, design, and support by the breathing therapist, we are confident we can succeed. We are seeking 250K in funding to scaling our growth and impact, and we welcome you to join us shaping the future of data-driven well-being.
One, two, three. Okay. Hi, thank you for your pitch. I have a question about the competition.
Okay.
How would you beat those huge competitors as Headspace, Calm, etc.?
Good question. Well, we are not going to compete with them because we are creating something different. 80% of our team is represent Gen Z generation. So we know what our customer are looking for. They're looking for the easy solution that will be really personalized, and that solution that will know and make the sense of the wellness data that our customers provide to us. So to answer your question, we are planning to create truly personal experience that will help solve the issue of our customer in minutes. You don't need to answer hundreds of questions every time when you need it, when you need the support. One onboarding, and that's enough.
Okay, but you don't need to answer hundreds of questions.
Believe me, yes, you do. We did it.
Headspace, I'm sorry, yeah. Maybe first onboarding, yes. But after that, if you use Headspace, you just open the app and open the meditation, and that's it. It's
and
like
it's
5
general.
seconds.
And it's general meditation that will be offered for everyone.
Okay.
Yes.
So next question about this generalization and personalization. So you will be focused, as far as I understand, only on those people who use devices that are tracking their well-being, right? Or it's more complex?
It's more complex. We are starting by using the data that your phone provides, that you would like us to know about you, like sleep and activity level,
if I do not
level.
use any devices to track my sleep, so
do
I
you
will
have
not be your
phone?
user.
Do you
Yes,
have
I
a
have
phone?
but if it does not track my sleep.
Believe me, they track a lot of patterns, a lot of data about you, and those of the data that basically help us to understand what type of activity you are having and what type of stress level you have. So the basic data is there.
Okay, I have to believe you, but I don't actually.
Yes, yeah. When you open the phone, for example, Apple phone, you have the health built-in app, and it's track a lot of data about the customer. But of course, to provide more personal approach, as more information you share with us, more personal recommendation you will get. But it's not the only thing. The main thing is your breathing patterns. This is the main key to get the best recommendation that we provide. The breathing patterns are the key to personalize the practice.
I have a question about your product.
Yeah.
What is the product development level you have right now?
Our startup 1 month old. We have the closed demo ready so far. And we are planning to launch MVP in a few weeks. As of now, it's already working. It's already providing you with a personalized breathing practice to manage stress or help you with the sleep or to focus. And in a few weeks, it will be open for everyone. Now it's for the closed group, and in a few weeks, it will be open for everyone.
And actually, about your question, I don't get your main competitive advantages.
Sorry?
Your main competitive advantages, your killer feature, your main something you can use to be different on the market.
Something what we can use to be different? Yes. It is the question. Okay. We tailor the experience based on the breathing patterns that our customer has. Plus, you don't need to know much to understand how all works. Our recommendation based on science, based on your breathing patterns, and the data that you provided us, and the request what you would like to achieve.
But it's easy to copy for competitors.
No, it's not copy, because no one yet combined as much features as we are. Plus, we will be one of the first app who will be adapt to the mood and request of the customer. So even the colors, even the shape of the answers will be adapted based on your request.
Sounds good.
Yeah, and last question, could you please tell us more about your team in more detail?
Sure, let me get back to the slide. So more than 6 years in mobile development has our co-founder Slava, who is also here. And he's one of the key experts in the mobile development. So when we talk about apps, we are confident we can deliver what we would like to deliver. Me, I have more than 15 years in business management marketing, and I've managed a project more than $2.5 million and contribute to the more than $180 million company for the last few years. So I'm quite confident with the big numbers and the managing big teams and working with the ambitious project. Then we have in our team Vlad, who is unfortunately not here, but he is responsible for the AI part in our model. Then we have here our Chief Scientific Officer, and she's one of the brilliant minds in our team and provide us with scientific support. What kind of breathing practices, how each breathing practice can be adapted as per your unique request, your unique patterns of breathing to achieve just in the minimum time balance with your emotions.
Can I?
Sure.
I'm asking because we have some time limit. What data will be teaching your AI engine? When you speak about breathing techniques, I understand that at the moment you do it manually because you have therapists, you have practitioners, breath workers. But when we speak about like big, massive population, and you need to do the personalized approach, like what data do you use for education of your AI engine? The question is clear?
Yeah. So far, we teach our model on the data that was provided by the scientific part of our team. And later, it will be updated by the data from our customers.
Thank you. Thank you, Anna.
Thank you.
Thank you, the Mindship team. Yay! And before you're going to the coffee break, dear guests and jury members and to the teams, of course, I want to remind you that you need to check all the teams. If you want to have a conversation, if you want to ask them additional questions, those part whom you actually see and heard before, please pick up them and have a great network at this coffee break. And of course, you can pick up our photographer because I know that everyone wants to have fancy photos. So please use your time. You will have 20 minutes for that. Ну а що? I'm welcoming all of you, dear guests, teams, and jury members to our main room, to our venue, because we are continuing, and our next startup also is ready. So I'm waiting for you guys. Please enter to our main hall. Thank you very much. So yeah, we're ready to continue our final block of the pages and the last keynote speech. So yes, dear guests and jury members, please take your seats. And the teams, of course, yes, too, take your seats, please. Yeah. That's announcing only for those who are offline, of course. Sorry for those who are with us online. We are a little bit chaotic after a coffee break and excited about the next part of the pitches. And I want to welcome to this stage Vladislav Kalushka, the founder of the Extravision startup that will be presented now.
Hello, my name is Vlad. I'm CEO and co-founder of Extravision. But also, I am practicing neurosurgeon. Working with human brain, it takes me and my colleagues days for planning the surgery in correct way. Because during the surgery, you can see through the head of the patient, and route is based on our memory only. Imagine how cool it would be to build this route just like Google Maps does when we drive a car. Because wrong turn in the brain can change someone's life forever. Even simplest surgery can have complication. 2-3 millimeters out of target makes patients suffer from speech, memory, or movement issues. It's a huge market problem because hospitals spend a lot of money to deal with postoperative complication. That's why we created Extravision. We transfer standard radiology images into 3D hologram and project them by AR glasses directly on a patient. In just 1 year, more than 150 surgeries have been done with our prototype in 4 different hospitals. It makes surgery faster and critically safer for patients. There are 3 types of competitors in the field: flat medical image viewers, fancy neuronavigation station, and other AR solutions. With focus on artificial intelligence, machine learning, and real-time data-driven insight for doctors, we have advantages in this field. Our neurosurgery market is very focused, and we venture to grow in developing healthcare market with strategic focus on medical students and residents. We already have paid surgeries. With different pricing strategies, we are affordable for doctors, hospitals, and medical schools. We are seeking strategic investments to scale up number of our clients by onboarding 100 surgical departments and 30 medical schools within the next 18 months. With our industry expertise and expanding our technical team, we create a product which really matters for doctors because it's reducing anxiety for them by taking responsibility for patients' life. And now we are looking business development teammate to expand our team and grow faster. Join us, and together we create technology that make difference for all doctors worldwide.
So, any question? No. Okay.
Oh, that's correct. Amazing, actually. I have a question about competitors. Tell us more about similar solutions in another different markets.
Yes, thank you for your question. Surely there are quite similar solution in a field of AR technology because it's technology in developing and a lot of companies building their own hardware products and software. There are some direct competitors in USA and EU market, but our main advantage for them is that we don't use volume rendering technology. We don't show just data from standard MRI scan. We labeled every layer like skin, vessels, tumor, etc. And then we project this information by AR glasses. So this is the main advantage.
Valeria?
Hi, thank you for your pitch again. And I would like to ask about your progress during the last several months because I knew you before. So how your product changed, if it changed, and how is your search for BDO or business development person, how it is going?
Yes, thank you for the question. Yeah, we have some changes through this several months. First of all, we built our local rendering solution, which we are testing now, and we transit from cloud-based rendering 3D models to our local because it's easier to deal in any condition with any connectivity issues. Another part, we going to universities. We start using our product in educational process. We build our first for educational purpose content to ventriculostomy placement, and it started in Kharkiv National Medical Universities. We start to use it, and we'll expand this technology further. And yeah, we see our good and not so good sides of our expertise. So we're looking for business development person to expand our team.
Thank you for your answering, and that's all. Yeah. Okay. Thank you very much. The next two teams that will present will be online. We have unstoppable founders and even some force major. They are just don't stop them. That's why I want to introduce you the next speaker. It will be Olena Sergienko, Health Helper Startup. Olena, do you hear me? Yes, we are hearing you and see too. So you can share your presentation and start your pitch.
Thank you very much. Hello, everyone. I am Olena Sergienko, and I would like to present you Startup Health Helper, saving your lifetime. Health Helper, methodology for measuring blood speed and blood pressure, mobile device, just touch with 2 fingers. Measurement instantly and accurately, saving your lifetime, and our mission to develop and popularize ideology of conscious attitude to own health and early disease prevention. Main problems: untimely and irregular diagnosis, reduction of doctors, lack of access to diagnostic. This is even younger age, expensiveness, inconvenience, and stress, and available analog do not meet to accuracy requirements. According to the World Health Organization, more than 80 million people die every year from cardiovascular disease, which accounts more 31% of all deaths, and more than 1 billion people and 58% not diagnosed in time. What is the blood speed? Blood speed is your electricity. And I think you know joke about Wikipedia, Google, Internet, and electricity. Blood flow is the indicator of the electricity presence in our body. Risk of development cardiovascular disease: would you like to live 20 years longer and to be healthy and active until 100? Check your health without expensive and complex examination, and we have solution. Health Helper. It consists of hardware platform and original software. Allow to monitor your health with medical accuracy and scientific approach. Calculate health indicator for early diagnosis of the disease. Our competitive advantages: it's a methodology for measuring blood speed. No stress, no invisible methods, easy to use, mobility, cost, and sufficient survey enough for early diagnostic. Customer benefit: to detect disease before the first alarming symptoms result, to prevent the progression disease and its transition and chronic stage, to reduce the risk of concomitant disease and reduce financial cost for treatment. Health Helper business model: it's include a sector B2B, B2C, and B2G. Marketing map: how to how to cooperation with the end customer. A roadmap for the next year, and traction procedure programs for now. Health Helper common goals is to increase the efficiency of the system for monitoring human health indicator for a simple and accessible way. Preventive diagnostics is only working strategy for predict crisis situation, helping to prolong life by 10-20 years, maintain health by 79%. Health helper monitoring, buying your lifetime. Our team requiring enter saving your health helper, saving your lifetime. Thank you very much, and I am welcome for your question and feedback.
Thank you, Elena. If you're hearing us, so you will hear the questions from jury members. Dear jury members, do you have any questions or comments?
Yes, we have. So thank you, Elena. I would like to ask you to tell us a bit more about the exact indicators that are tracked with this device. Hello?
Elena?
Yeah, I'm here. Health Helper is a mobile device. It's a device and methodology how to measuring blood speed. Firstly, it's so important indicator, blood speed, and then we calculate blood pressure and another indicators for our health. But main and most important, it's a blood speed.
Why do we need to track blood speed?
Scientific approach.
Yes, why do we need to track the blood speed?
Blood speed because it's a so important indicator, and according to the blood speed, pathologies of various organs are detected: blood pressure, vascular status, defects, blood clots, and heart health. So many importance we can detect it if we know our blood speed. Now we measuring only in the clinic, in hospitals, or invasive methods, or and only with doctor or medical assistants. Not so popular mobile and easy measurement this indicator.
Thank you, Elena. We have another one question.
Actually, it's a follow-on. So the blood speed is something I think most of us haven't heard. So it would make a lot of sense to start with explanation why blood speed is important and what it helps measuring. And here's the question. So say my blood speed is low or too high. What does it mean? What's the next step after that, right? Can you diagnose a particular disease, or do you just say, well, there could be a problem, go see a doctor? So what happens after I make the measurement?
Question. Yeah, we have a special table, and we have special norms. What's the normal blood speed? It depends for age, especially age, and some another disease a person has. And for example, blood pressure, it's consequences of our blood flow. And if I measure in my blood flow, I will predict my blood pressure. And more people in our world have not good blood flow, blood speed. It's it's a reason for a lot disease, and if we know and simple way how to measure blood speed, we predict a lot big diagnosis.
Okay, so say you can say I have high blood pressure. Can you say what kind of problem I have, or do you just say you might have a problem, go see a doctor?
Yeah, we calculate. We have this measuring in cloud. Your doctor have access for this indicator. And for example, if you have not good norm during 1 week, your doctor allow you to more deep diagnostic, more expensive diagnostic in hospital to blood speed and another and another disease.
So-
Yeah, it's express express diagnostic.
Elena, 1 second,
first
please.
time. Mhm.
Yeah.
So basically, you can just say, you can measure the blood speed and blood pressure, and that's it. And from there, I should take you to my doctor, right?
Yeah.
Okay, thank you.
Thank you, Elena.
No, it depends on situation. Yeah, thank you.
Additional question, please, from Anastasia.
Thank you so much. Can you show once again your team, please? And tell a little bit more about who is in the team.
Our team, I'm Olena Sergeyenko. I'm a doctor of science. I'm a professor and I'm working at university, Kharkiv Polytechnical University. As my profession, I'm analytic, I'm business analytic. Igor Sosnov, R&D, it's a PhD in technical science, and our CTO. And project manager Valeria Vertigel, it's my student, and Maria. Now we working, it's a team, and we have some people in outsource.
Thank you so much.
Thank you very much, Elena. Okay. I think that Elena don't hear you because of the micro. Yeah, Katerina, please. We have a comment from the Katerina Potaplova.
A quick comment. My name is Katerina. I'm a neurologist. So your investigation can lead to overdiagnostic. Even I'm neurologist who advise patient to make ultrasonography that measures blood flow and speed of this blood flow. Sometimes we receive measuring like your blood speed decreased on 5%, and patient come to me and say, oh my goodness, what happened to me? I have a stroke and other things. So I guess the better way how to sell your investigation is to say that you make a blood pressure diary. Right now, every day I have 10 patients per day, and for 60% of them I prescribe to make a blood pressure diary. I need this information to prescribe medications, and I need 2 weeks to understand what is the flow. So you can say that you digitalize this diary, not on a paper like my patient sent to me, photo of the papers that they handwrite. You can make this for neurology patient, cardiovascular patient, and for others conditions. Thank you so much.
Thank you for your advice. Thank you very much, Elena, for your presentation and for your answering. And we are ready to go into the next team. And the next team will be the Progolite team. And I want to introduce you Oleg Vustenko, who are also already online. And we see you, Oleg.
Hello, everyone. Happy to be here and to present our startup. Can I start?
Sure, you can start.
Okay, so we are Progolite, and we are revolutionizing kidney stone disease treatment with our innovative model, which is called programmatic electrolysis. It is powered by Progolite software as a medical device. Kidney stones are a significant health issue affecting millions worldwide, and traditional treatment in outpatient setting is based on self-control. and often is ineffective in preventing recurrence. And patients feel a lack of control about their disease, not proper quality of life, and there is an economic burden on healthcare system which is massive, reaching billions of euros annually. The solution is Progalit. It is a win-win solution for patients, doctors, and payers. Our AI-powered platform personalizes treatment plans, monitors progress in real time, and proactively adjusts medication to optimize outcomes and prevent recurrences. This leads to increased doctor efficiency, reduced recurrence and hospitalizations, decreased healthcare expenses, and improve patients' quality of life. As element of our solution, of our platform, that is a chat AI-driven agent, which provides information from patient to doctor and from doctor to patient, but in the same time, we maintain the records from analytics from the metrics received from patients, which is patient diary, level of pH urine, and also track of log of the interaction with the patient between doctor and patient. And it is just one element, but I think that's something that we can just show right now to illustrate our solution, that talking with our AI-driven agent, patient and system interact to dissolve kidney stones. Next slide is about our B2B2C model. We offer a unique value proposition that benefits both clinics, insurance companies by generating new revenue streams, reducing healthcare costs associated with kidney stones. We are in global market, and the opportunity is a multi-billion-dollar. Progalit is positioned to capture significant share of the market as a soft medical device and also as a personalized outpatient treatment in kidney stones. We position ourselves in terms of competitors as a solution which is very flexible with integration to electronic medical health records to serve as an extension for outpatient treatment of the patients. The founders are myself, Alexander, and Dmitry. Dmitry is a urologist, the one who started this idea because he had to dissolve the kidney stones for her patients. She was that time in South Korea, and as a urologist, he set up the first version of the Progalit, and currently we have 80 patients who test the proof of concept. It is already tested in Poltava. We have results with the patients, with doctors. We prepare scientific article to address the results, and we are quite successful in fundraising. Over last year, we secured the initial pre-seed funding, which helps us to develop further. But our finance strategy is focused on further investments, and now we are raising 250K as EU pre-seed, which will help us to start registration of our solution in the United States and the Euro Union in order to develop and expand to that markets. And thank you very much. Ready to your questions.
Thank you, Ale. So, do we have any questions? Yes, we have.
Yes, I think yes.
Oh, okay. Can we turn on all the micro?
Thank you for your pitch. Could you tell us more about your technology inside, how it works, and how do you protect it if you have success with this?
So in 2017, this was patented as a new model in Ukraine. And it is written in the patent that this kind of treatment was possible at that time, in 2017. With the evolution of the technologies, and when we have finally accessible AI models, that is the advantage we would like to leverage, in addition to the already available solutions which was developed by us. In the backend, let's say we have interfaces for doctor, for patient, that can be application, both web-based application, that's just interface. The main part is analytical core, which was developed by our founders, by Alexander and Dmitry, and they use publicly available information in terms of the methodology of treatment, but what is our know-how? It is the model which allow us to forecast the pH level of urine based on metrics we receive from the patients. That is the hypothesis which we are going to test with the clinical trials. Currently, it is under development. We cannot prove it. We don't have the clinical trial results so far. And I believe it is. Yeah, I think it is worth to mention that we have already, of course, copyright of our software in the United States in Congress, and we have ProGalit registered as a trademark in Ukraine and in Euro Union.
One more question. Can you go back to the business model, please, and explain the business model? Yeah.
Yes.
How will you charge?
Business model B2B to C. As I mentioned, that is about model of treatment. Model of treatment of patients who have now self-control. And with the help of software, it can be more close to them and to the doctor. And we connect doctor and patient on the same platform. And that is a new approach. And that's a new service for the clinic, which can be covered by the insurance or patient by themselves. So in other words, we give a tool for clinic, which they can use for another type of services for their patients in outpatient treatment.
Okay.
And just to mention, outpatient treatment and prevention. The treatment, it is 3-4 months, but the recurrence rate is 50% in 10 years. So it means that once patient is using ProGalit, it means that he is locked somehow to this clinic in order not to receive recurrence, and followed up with doctor on the level of ongoing follow-up for prevention of the recurrence.
Okay, so how do you charge for the service? Is it per patient? Is it per fixed amount?
We have setup fee for the clinic. We have fee for a number of accounts of doctors in the clinic. We have 2 ways of setup. It is with integration with the EMRs of the clinic or just access to our platform. And besides, we have price per patient on maintenance. So we help the clinic to ensure remote monitoring, treatment, and follow-up. And for each country, it will be different. And I think that the financial model will be more robust when we have this on the market, which is going to happen in Q1 next year.
Okay, but can you give us the forecast? So if we consider one clinic as one client, what's your estimation of LTV, the long lifetime value of the client?
Well, I think that for us, it is important to have, I can express the results based on the proof of concept, right? The proof of concept is much more simple solution. And we have 20% of the service provided by the clinic to the patient as our fee.
Not clear. Can you give me the number in dollars for, say, annual contract for an average
all right.
clinic?
Yes, sure. Currently, we have 300 euro as the price of the urologist consultation for the programmatic lipolysis. Usual consultation of the lipolysis, right? It is 200 euro. Within this extra value, 100, right? We take only 20 euro. And the rest goes to the clinic. That's how we have it at this time point as a proof of concept with a minimal number of patients. But it is enough to cover all our IT infrastructure, all our production and so on. Because indeed, the solution itself as a solution is not that much expensive. The number of patients and the number of and the need, it is what we see as a market opportunity.
Okay, thank you.
Thank you. Thank for our jury members, and thank you, Oleg. Applause, applause.
Thank you very much. Good luck to everyone.
And we're going to the rapper military startup, and I want to introduce you Olga Zaritska, who will present this.
Good evening. My name is Oля, and I'm part of Rapper Military Team. That is a project that is dedicated to supporting military personnel in matters of reproductive health, rights, and career conservation procedure. So, to begin with, let's talk about the problem. And the problem is that military personnel and their partners lack knowledge of how to carry the career conservation procedure, and at the same time they face some psychological obstacles that stop them from this procedure. So what's the solution? We can divide our solution in two parts. The first one is education, and the second one is online platform that will work like concierge service. And if we talk about, is it new? Yes, it's new because now we have only clinics, so where we have scattered information in the internet, and so on and so on, but we provide the unified system where everything is in one place, where it is safe, where the patient can get information about how, where find the doctor, psychologist, and so on and so on. And if to speak about the market, according to our calculations, around 150,000 military per year are at risk of infertility, and our aim is to help these people. So, if to speak about the competitors, we know that there are lots of reproductive clinics. But at the same time, we want not to compete with them, but become partners with them. And of course, we know that in our society, there is a huge stigmatization of the theme. And our educational part, the aim of this is to beat this stigmatization. And if to talk about the business model, now we see it at the partnerships with clinics for referral-based revenue or B2B model. Now we are going to promote our product through the social media and through the advertising with our stakeholders. And here you can see our roadmap, and you can see where are we now. We have already started our informational marketing campaign, and at the same time we started our surveys. But as you can see, we have lots to do. Now we need around $20,000 per year, and the biggest part of this money we are going to spend on technological development. And here is our beautiful team. And if you have any questions, I will be very happy to answer them. Thank you for your attention.
Hi, I'm here. Here. Just right. Yeah. Hello. Thank you for your presentation. I would like to ask more about your team. It was so fast.
Okay. So let's have a look. Like in the whole of all of us are students. The whole of us are medical students, 5-year medical students, and other part are students of Taras Shevchenko National University. Like in on the right are Taras Shevchenko students. On the left are Bogomolets National Medical University students.
Okay, and why did you choose this topic for your startup?
Now Ukraine is facing really hard times, and in the same time these obstacles are destroying our demographic situation. You know that now Ukraine has the lowest birth rate in the world, with 0.9 children per woman, and that's really low numbers. And according to United Nations prognosis, we have very bad prognosis, because they say that 2001, like until the end of the century, there will be only 15 million of Ukrainians in the world. So that's very difficult to understand that your nation is dying, and the career conservation is the procedure that can save your germ cells from bad obstacles of the environment, even if you are planning your children not now, but in few years. Then, these cells are saved, and they have very good potential, and they are not influenced by risk. So that is why we concentrated on this problem, and why military personnel, because they have higher risk of development of infertility.
Thank you. Beautiful. Thank you so much. And I congratulate. I know that you've been in Ideaton, and now you're here. You've moved so far, and it's beautiful that it's student-led, youth-led, and women-led. Amazing. My question is about the team. Do you consider to engage someone from the military personnel, but also like community, military community, soldier community, veterans community? And also about reproductologists, about clinicians, or clinicians.
Yes, we understand that we need, we are students, we are not professionalists. So we need the reproductive psychologists, doctors, and other doctors, for example, in the field of obstetric and gynecology, and urology, of course. In the same time, we understand that we need the military personnel, because in the military field, it is very important to make this connection that you get information from the person that is your person. That is why now we are working on our partnerships, and we are looking for doctors, psychologists, and militaries that can become the face of our project, and promote it among colleagues.
Olo, thank you. Can you elaborate a little bit more on where precisely is technology? Why do you call this startup health tech, but why it's not, let's call media popularization, project, or you started that it's project, let's say startup that popularize the topic of reproductive health. Can you make focus a little bit on this?
Thank you for your question. We understand that if we are talking about just media content, we are like an only volunteering project. But at the same time, we need to money to feed our project. That's why we decided to create technological a platform that will be like an concierge service for personnel that decided to do that. And our aim is to connect everything in one place. So you don't need to look for in hundreds of websites whether it is safe or not, or to look for clinics or doctors. We see that in the platform where you just came, you get information if you need so, and you went to the doctor and the procedure is done. So we are carrying our patient from the idea to the result.
And where is the technology?
Technology,
where is the technology, and where is tech person in your team who is responsible for this?
Yes, thank you for this question. Now we see it as a website, but now we're looking for the person that, or a small team that could develop that.
Okay, and I also want to add also about your team. Female-led and female startups are great, but diversity matters in both ways. So please think about adding some guys to your team, especially taking into account that the topic that you are covering is mostly about men, not about women.
Yes, we are working about that. Thank you very much for your advice.
Thank you, Ola. Thank you for your presentation, and applause to the Repro military. I'm coming to the team Vitametria, and we're continuing with female founders. So meet Katerina Bohorada.
Hello to everyone. Applause.
Make more support to Katerina while we are waiting.
Okay. I'm Katerina Baharada. I'm founder of Vitametria, and I'm really excited to introduce my project today. We are waiting for my presentation, and let's start. Super. Okay. This project is inspired by my personal experience and challenges I faced becoming a mother and navigating our medical healthcare system. That's when I realized that no one could take responsibility for my family's health but me. I discovered that prevention care is almost overlooked by official medical providers. And as it turns out, it's a global issue. And in Ukraine, it leads that every second person has at least one chronic condition. But when people experience early warning signs like hair loss or constant fatigue, they struggle to get advices from doctors. Seeking for solutions, they turn to near-medical specialists, while consultation with a reputable expert starts at $100. That is unacceptable for many. That's where Vitametria comes in. Our goal is to propose an alternative solution to democratize preventive approaches and empower people to take their health under personal control. We believe that health should be measurable. Moreover, for many, tracking health metrics isn't just useful, it's essential. That's what Vitametria stands for. This application designed to help people find right path to better well-being and make informed health decisions. Market. We started our investigation from medical diagnostic tests market, which is rapidly expanding despite of all economic challenges in Ukraine. 50 million tests conducted annually, with 10 million Ukrainians participating. 40% of these people undergo testing more than once a year for prevention or chronic condition management, making both groups our target audience. Our own CASDEV showed 4% conversion rate in expressed interest in tools like Vitametria. And this is just the beginning. We are already designing endpoints for international scaling. Competitors. The only solution with a similar idea here is ornament, but Vitametria is definitely much better fitted to Ukrainian market, while other competitors only partially replicate our functionality and are designed entirely for different purposes, leaving us room for a unique market position. A few words about team. We brought together experts with diverse technical skills and passionate enthusiasts who are deeply resonated with a project's idea. Together, we are bringing Vitametria to life. Despite of much broader vision of this project, at this moment, we are focused on launching the Vitametria app. But my ultimate goal is to make Vitametria synonymous with health monitoring in Ukraine. If you need to take tests, you need Vitametria. And at this stage, we are seeking for 50K in grants or angels investments to finish development and ensure successful launch in Ukraine. Thank you very much.
Thank you. First, just a small comment. When you are thinking about the future, if you have such a digital product, please think more globally, because you said just that your plan is to be #1 in Ukraine, but you can target global market, and it will be absolutely fine. The second. It is actually the question about why do I need your product? Because on the competitive, on the slide with competitors, you showed that there is Healthy, there is Cineva, and actually, as far as so from my experience, if I make some tests of my health, I go to Cineva, and then in personal cabinet I have everything, and the next time I will also go to Cineva, and so I do not need usually a lot of laboratories for tracking this. So why do I need you if I use, for example, Cineva, which is one of the most popular laboratories in Ukraine.
Thank you for the question. Of course, if you're a Cineva customer, maybe you're not interested in vitametria, but it's some limitation in your voля, in your freedom. And many people are seeking for libraries based on price of tests, and libraries from time to time have some discounts for some tests. So our tool empowers them to make this process a little bit cheaper and convenient. They are not think that, oh, I have only all my data in Cineva, so I should go and again to them. So this is for. And another thing, it's even Cineva's cabinet don't allow you to track dynamic, but our application could.
Thank you.
Katerina, thank you. The basic question, what's the value proposition? So if we go to the very, very start, like the general idea is, it's understandable, but I mean, what would make me register and become your user?
It's the most hard point in our story, value proposition. Our value proposition is have control under your health.
Okay, it seems like I have control. Why should I register?
What?
It seems like I do have control over my health. Like, so why do I register?
Sorry, I didn't understand the second part.
Look, I mean, yeah, what should motivate me? I mean, I don't understand. So at this point, I mean, the general idea is very good, right? But at this point, I lack the understanding of what's the exact value proposition. Like, what me as a person who might have or might not have any health issues would register and start using it. What do I get out of it?
A main motivation may be when you have already some issues with your health. Of course, health people very rare think about some diseases, future diseases. But when people face some problems, and especially when they are on very, very early stages, and doctors just say, okay, your tests are in normal reference, so just sleep more. But you want to understand what's happening, but you feel that something to do. And in this case, you can be interested to use such a tool. You are going, or another specialist like nutritionist who can explain you, or use this tool that can give you initial understanding of some health metrics.
Okay.
Short one question from Petro or Valeria.
I have a comment on this.
Okay.
So if you want to comment also. Go.
No, just what I'm trying to say is that it seems like you want to target people who don't have problems yet, right? But those people are not motivated to do anything about their health.
I agree.
They don't feel that they need to do something. So how do you get people on board who don't think that they need to get on board?
In my presentation, I thought about people that our target audience is the people who undergo testing more than once a year. If they do this, they have some reasons to do this. And if they are or have already some conditions that they should tracking, or they really are very озабочені of their health, and they do it for prevention, and they also are interested in a tool for storing this data and to taking the dynamic and track early warning відхилення.
That's a valid hypothesis. At least you have the cohort of people whom you want to target. Thank you.
Yeah, and a small comment on this. You started your presentation with the photo of your kids, and I was expecting that all this product is for families who want to track the health of their kids. And it came up that it's not, is that it is for people who have some diseases. So just a comment and recommendation to pick one or five, whatever, typical customers and build your presentation on this. So even when you are asked for who is your audience, so you can answer more precisely.
Actually, thank you very much for this comment. Actually, really, this project about target audience is mothers, because they are responsible not only for own health but for health of their families, and it's a little bit tricky than tracking only one person. And we have some features that make simpler this process for people who are tracking health of their relatives.
Thank you very much. Sorry, guys, I will be super strict for further 2 teams. And even jury members, first of all, you will have less time for the questions. So I want to introduce you the next team. And it will be Request. Welcome Dan Kucherenko to this stage.
Hello. Have any of you ever experienced burnout? How was it? Shitty, right? I faced it too, and it was really, really painful. That's why I started Request platform that boosts employees' motivation and engagement. Let's see how huge is the problem. According to Gallup research, only 23% of employees are actively engaged at work. I repeat, only 23% of worldwide employees are actively engaged at work. Do you realize how it affects companies? Disengaged employees aren't just less productive, they harm team dynamics, customer relations, company's profit, and most likely they will eventually burn out. Disengaged people also cost companies 34% of annual salary. Thus, companies with 1,000 employees and annual average salary of 50K loses 2.5 million a year. And the numbers are higher for larger companies. Obviously, we are not the only one who work at this problem. And the global corporate wellness market is projected to reach 95 billion by 2030. And from our research and interviews, we know that disengagement unfortunately can't be fixed by one solution. It requires a complete system. Let's be honest, meditation won't save you from an asshole manager, right? But Request will. Because we combine mental health activities, tool management, real-time analytics, and much more as all-in-one solution to boost employees' engagement. An ambitious project requires ambitious team. Let me introduce you. Ivan, engineer with 11 years of experience and practical knowledge of AI integration. Me as a CEO and former team lead with 6 years of team management experience. Our dedicated developer Nastya and psychologist Anya with 10 years of corporate and individual therapy experience. Our business model, simple yet profitable. $9 per month for each employee, and with 8 big enterprise companies, we will get $500,000 of ARR. We will get there in simple steps. Provide MVP for first 6 tech companies, then build advanced features, and fully enter European market. Then we will go to US and global market, just in 2 years. We ask for, to achieve that, we ask 400K of investments that will fund our product development, our marketing and sales. Please, stop treating burnout. Let's prevent it. Thank you very much.
Hi, I have a question about your clients, actually businesses. How will you sell your product to them, and how you will track the progress of all the employees?
Yeah, good question, because tracking the progress of employees is our first feature. We will first measure the burnout and engagement rate of the company. That's how we will enter the company and sell our product. And the sales funnel pretty easy. It will be called outreach. That's how we find our first HRDs from different companies for interviews.
What will be your unique selling proposition for these clients?
First of all, we can measure burnout and engagement and predict how it can affect companies, and then provide personalized activities to prevent the total burnout.
So it should be obligatory for all employees in the company to use your tool?
Yes, if company want to track this measure.
How your tool is look like? What is this and how it works?
The tool will be like a platform for HRDs, team managers, and C-level to see dashboards with analytics and insights. As for employee, we will provide AI bot integrated in Slacks or Teams.
So your bot will analyze...
He will speak, ask questions, and analyze results, yes.
Okay.
What kind of questions, like how happy are you today, or what is it?
Yeah, kind of, but a little bit deeper.
Do you like your manager? Okay, look, the obvious question. Do you expect pushback from the employees?
Yeah, of course. That's why we want to provide reinforcement for each employees. And we already speak about this with companies, and they say that it's a good idea to give some bonuses for employee to answer questions and to be active with our agent, because agent can not just provide questions, he can suggest some activities to boost well-being. So each employee can gather these points, and after the end of the month, he can transform it for some day off or bonus for salary, etc.
Okay. Do you have any proof that your product works?
We have overall proof of the engagement that we use, that they can pretty good result of predictions. Yes, and we will combine many of surveys into one solution. So we will use another surveys built from 40 years of some research, and then we will use this in our platform.
Okay, but can you say how effectively can you identify disengaged employees, and how effectively can you turn them into engaged employees, if that's the point?
Yeah, I understand. Good question. I can't say you the percentage of our measurement right now, but I'm sure that we can do it.
That would be very helpful for the pitches.
Mm-hmm. Right, thank you very much.
Thank you, and thank you too, Dan. I'm ready to announce you the last pitch for today, but not the last speaker for today. And I'm happy to welcome to this stage Roman Havric, and Roman presented Anima.
Hello, everyone. You heard a lot during previous pitch about our problem. So we are Anima. We are a neuroscientific one-stop shop for your organizational mental well-being. Problem is huge. You already heard about it a lot. But our solution, according to Deloitte, is based on screening, because screening proved to be the best method for mitigating mental health issues within the company. But we don't stop there. We suggest you also organizational and department mental health reports and recommendation, alongside with 24/7 and eye therapy support, which is informed by our algorithm, and it is super accurate and helps a lot. How it works: employee takes unique neuroscientific tests measuring behavior of eye movement in response to stimuli. Then this data is transferred to LLM, and LLM gives you an unique personalized insights into your psyche that you will find never accept of anima. Our innovation is based on online eye tracking for attention bias. Attention bias proved to be the best biomarker of mental health condition. That's why our LLMs are so informed and so accurate. And that's how we look like. That's how your report looks like. Market is huge and rapidly growing, and our competition is vast, but we have something to offer. We are way cheaper than online therapy, and we are way easier to use than online meditation and other stuff like this. And we are the most accurate based on biomarker analysis. Our team is well equipped with anything that we need to succeed, starting from neuroscience, therapy, psychology, data science, machine learning engineer, because it's like half of a team here. We have more of them. And now we are selling, on average, let's say our lifetime value is 10,000 per company, but most of our contracts are prolonged, so it'll grow. Here is our clients and partnership ecosystem. Some traction. We received already $140,000 in revenue, mainly during last month. We are looking for $500,000, mainly to unlock US markets, and we work in different tickets. Thank you, that's it.
Hello.
Hello.
Actually, I know about your product for like 2 years, and I would like to ask what changed during that time.
Well, a lot has changed. We started doing different research for example, for our military, we did concussion research for concussion test. We are doing now research for eating disorders with biochemists as well. And we are launching a therapy version soon, I believe. This B2B version we launched already and already sold a few contracts, but we are launching a landing page and we'll promote it soon as well. What else? We onboarded several B2B clients. We did several white papers with Soccer Foundation as well. I don't know, a lot has changed, yes. We are now working with some clinic, one of the biggest private clinic, in order to incorporate our services in their proposition. So, yeah, we've been busy. Thank you.
Roman, hi again. Also,
hello.
We've talked a lot. So you've done a lot of research and white papers. How do you get this to the market? I mean, when do we see this product in every phone measuring us daily?
Well, step by step, we'll start with corporations. They have influence over their employee and the interest in understanding their employees' mental health. But we also work with clinics. That's how we will integrate from different angle, let's say. And we will sell as is. You can use it right now, anima.ua, but only with laptops or desktops, no mobile for now.
What's your top 3 use cases?
Top 3 use cases from B2B. In B2B, that's just mental wellness programs. So basically, we're targeting those companies who already have in place mental wellness programs, and they want to understand whether they're working or not. So that's pretty straightforward. But also want to manage effectively their workforce. That's why we are for, especially with this AI chatbot. That's really helpful. It scores better than PhDs in therapy. So in psychology. So we are quite good in this. Yeah, so that is the main, to measure mental health condition of a workforce. Second is to integrate into their proposition. We have several contracts working for, let's say, as behind the scene, as API, we sell as well, and also for social programs. So if company or fund launching some social campaign or some social program, they want us to be part of this. So 3 use cases for B2B.
Why don't you go for more practical cases, like, for example, I don't know, Uber? Like, you can start your...
No, Uber is not stable.
No, but I mean, any other company, like you can drive a car until you do the test.
Unfortunately not with our technology ability right now. In cars you have the same technology, but those top-notch versions of BMW or something, whether they measure your attention with the same technology, but only for your sleepiness. So they kind of use the same technology, but in a different purpose. But unfortunately with our technology right now, we can't use on the go, because we need one stable point for math to do it work. So we cannot use mobile for now. We will probably fight it.
What if you don't go on the go? What if you use like before the driver starts
It's
driving?
too complicated with the customer experience to integrate, like sit still in the car. It's like a bit strange use case. So that's why we prefer to go into, let's say, work or home environments for now. But yeah, we will switch to mobile, and then we will go whenever you suggest as well.
Because that's something very kind of understandable from the venture capital.
Well, that's my problem always. I don't understand venture capital don't understand me. So that's kind of always a conflict. Yeah, I know. Yeah, I know this problem. Yeah, okay, thank you.
He was quite humble today. I'm surprised. I really want to hear what is a big dream of Roman.
I was afraid you were going to ask this question, because this question is kind of a bit...
be honest. You remember, like in Beckham, be honest.
Yeah, if I'm being honest, I might, I don't know, be not super polite or something like this, but our point, mental health system worldwide is broken. So it's completely broken. Over-medication, misdiagnosis, overdiagnosis, all the problems that are present. 90% of therapies using non-evidence-based approaches. So it's like huge problem. And we are solving now, it's the wrong way mostly. So that's what we are doing. We are bringing science and new approach, this kind of evolutionary biology, evolutionary neuroscience approach to the problem, and that's our dream to change it from scratch, because we should do it from scratch. That's why, by the way, I don't really like when in Ukraine, in our mental health context, people say we need to adopt US technologies, a country with the worst condition, and we need to adapt their approaches. Oh, I'm not sure, but they have really good neuroscience, and this neuroscience is already present within our product. So yes, our mission and idea is to change the approach to mental health in the whole world.
How humanity will benefit from it? Because
oh wow. I believe...
you said it's unique. You said twice that no else in the world there is this democratized...
In neuroscientific labs, they have it for sure.
But not for everyone.
Not for everyone, no.
So,
the world will benefit like with how you can benefit from better mental health, like endless possibilities, let's say. So more productivity, more happiness, and we know this, by the way, from the scientific standpoint, that happy people are better, have better productivity, like 4 times. 4 times better productivity. So that's our promise, let's say. Use Anima and you'll be 4 times more productive. Thank you.
Thank you for the presentation. What an amazing showcase, actually. I want to welcome all the jury members to our secret room behind the amphitheater. left side. And while you're going to the room to finalize your scoring and starting the discussion, I want to go in further and introduce you the next speaker. That's actually Emma. Do you hear us? I want to welcome you, Emma Popova, healthcare industry advisor for the EMEA team at Microsoft. Emma is here, and do you hear us?
Yes, I can hear you perfectly. I was staying in the last 20 minutes, and I was very excited hearing the presenters.
Super, Emma. The screen and the stage is yours. Welcome in, Emma.
Let me share my screen. Can you see my screen? Yes? No?
То якщо треба залізти буде туди.
Can you hear me? Yes, no? Yes. Okay. So at any time, just a second, I'm sorry for that, but I'll reshare because I don't like how the sharing looks like. And please excuse me for a while. Okay, sharing. First, let me thank you to the organizers of having me here and Microsoft engaged in a so exciting forum. Actually, what you are doing right now is really defining how the future of the healthcare will look like. And really encourage you to go deeper, to go more, to leverage everything what the modern tools and especially AI can provide to us, of course, in the responsible way. So let me present myself. I am Emma Popova. I am based in Bulgaria. Unfortunately, I was not able to travel to Kiev today, and I'm industry advisor, part of the EMEA healthcare team at Microsoft. I'm working in the last 2 years with the customers from Central Europe, from Southeast Europe, from Western Europe from this year, and I can see that the challenges but also the possibilities what we can do in the healthcare are similar in each and every territory we have. And let me start introducing Microsoft. I can't start without stating our mission, and this is how we are inspiring and empowering every person and every organization in the planet to achieve more. That means that everything we do, every tool, every software, every solution we provide, we are making this to be of the benefit of our customers. And if you think this is not different for the healthcare, what Microsoft does these days is really to provide the next generation services which can overwhelm a lot of the challenges. And these challenges are many. I am sure you see many of these in Ukraine as well. So, of course, we see the trends that the patients and the doctors are behaving like the consumers, and they want to have the digital tools, the same access as they have in each and every other aspect of their life. But I am sure that the rest of these three areas you are much more familiar, and this is that first of all we have the shortage of the clinicians, and the predictions are that in the next several years we'll have a drastic shortage of medical personnel. Then we saw by the COVID, by the way, triggered that, and this was the use of the telemedicine, telehealth, telecare, everything we have in that area. But in Ukraine, I think the reality brings us much more to the speed of having the things done remotely. And this is here and this will stay. And the last, that these are the data. Now the hospitals are producing tons of data and they are siloed. Many of our customers does not have the healthy data estate, and the previous speakers were talking about implementing the AI. But the foundation of the AI is to have the interoperability between the different systems and to have really the good data to work with. Especially when it comes to the clinical decision support, if you need to diagnose someone with the mental health issues and to provide the supplemental mental AI-powered solutions, you need to be sure that your data are correct. That's why the previous speaker was talking about the misdiagnosed patients. I can give you an example from NHS. We are working with one of our data partners called Pangea, and the recent case of NHS was the savings of 1 billion implementing the solution of fighting the misdiagnosed patients. Whatever we are talking, we will need to be conscious about the security and compliance. A lot of regulations are coming. Now we have also EU AI Data Act, and I strongly encourage those who are progressing with their AI ideas and projects to look how they will comply with that requirements. Microsoft has developed our responsible AI framework. You will have my contact details. You can connect me and I'll share all of the materials, how you can achieve faster that compliance. And now let's talk what Microsoft does for the healthcare. We have started several years ago in line with our industrialization, with bringing the solutions close to the customers who are looking for the industry-specific things. With other words, based on our best-of-the-breed cloud technology, we applied that APIs, tools, integration models, AI models to be ready-made and to be used from our customers and our partners, and to shorten the time to market, plus to leverage the investments made into the cloud infrastructure. And you have done that in the 4 main areas. First of all, this was personalized, the area which is patient-related, how we are engaging our patients, how we are providing the access to those patients, how we are having the virtual health. Then we are moving to the care collaboration, care management, and really trying to save the time and put efficiency on the focus on the so important medical personnel. We are investing a lot into the clinical data and analytics. We, as Microsoft, are doing a lot of the researches by our own. Later on, you will hear about the projects in RI or the things we are doing in terms of the genomics research. But together with that, we are providing a lot of ready-made models for the operational analytics, clinical analytics, and in the same time, we are developing and we are going really deep with the ambient AI, with the clinical focused guidance, with diagnostic intelligence. Now, actually 1 month ago, we have introduced our software as a service AI layer called Fabric. Is healthcare ready? We have the Fire and DICOM already in the general availability, and we are providing a lot of the ready-made models you can use with Fabric. And let me put one video which is connected with our horizontal services, but it's a really good teaser of how we are using the generative AI to support the doctor's productivity and efficiency. Do you hear the sound? Hope the video inspired you with what the technology can provide with, even with the basic tools as modern workplace. And moving further, of course, what we are providing for from Microsoft Cloud for Healthcare is also extended through our really wide partner ecosystem. We are partnering with best of the breed partners, worldwide names like Epic, like Meditech. 2 years ago, Microsoft acquired a company called Nuance. Nuance is a leader in the ambient intelligence, and now it is fully incorporated with Microsoft commercial team. Now you will hear more for what we are having as DAX Copilot, but this slide is just to encourage you to continue invest into the tech innovations and thinking how we are making the healthcare better. And we have a lot of new names coming into that chart, especially from the startup community. I can give you an example like Be Wealthy. This is a Nordic company, which is one of the best developing from my perspective in terms of the patient outreach, and we have many more. Now going to the AI, obviously the AI is here and it will stay. If 2-3 years ago we were looking on the AI, this was still not so hugely adopted, but now the predictions are that the generative AI especially will unlock about 1 trillion unrealized improvement potential in healthcare. And we see it every single day. Last of my projects were in Czech Republic, where we are working to implement ambient intelligence, voice-to-text-speech solution for the doctors, which are examining patients, and this will save a tremendous time of instead of writing the epicrisis or writing what they're hearing for the patient, really to focus on the cure, not on the administrative stuff. I can't go further without mentioning what is indeed the potential for the companies which are basing their solution on the AI. The market is estimated to grow to 188 billion by 2030, and it will go in each and every aspect you can think. You are talking about outburn, about mental health, but think about the each and every direction where AI can play a significant role. Think about the AI, how it can mitigate also the doctor works. It's not always connected with something which is visible, but can save a tremendous time, efforts, and resources, even going with the AI administrative process, like a dispatch form. A dispatch form, usually now Central and Eastern European countries, is taking between 1 to 3 hours from all of the multidisciplinary teams to produce that discharge form. This can be done for a minute through the integrated systems and applied AI on top. They can play a role in each and every aspect, and we are dividing this in 4 areas: how we are providing the AI use cases and solutions to the providers, to the payers, to the pharma, and to medtech. I can give you an example of each and every of these vertical, like the ambient intelligence intended to support the doctors and the patients, like the clinical documentation and triage. For the payers, it plays significant role into the cost savings, into the fraud detection in the reimbursement system, into the supply chain optimization, and especially on the workflow automation. Especially with the payer, we're looking for the AI as a trigger to help us move from the fee-to-service to the value-based care. And when we are talking to the precision medicine and the public health, they are really very tight connected, and this should be done by the payer. In pharma is the fastest and the biggest growing in terms the segment in terms of the AI consumption. So it's obvious that the AI plays a significant role into the drug development and discovery, but think how the generative AI with the simple summarization in providing a fast access to the literature review. How we are making a summary of all those new inventions, new articles, everything new what is coming. Clinical trial and management. I remember 2 years ago when I started working as in the healthcare at Microsoft, we are having one customer in a small country in Central and Eastern Europe, and they were having 300 doctors working every single day to find the patients for the certain trial. Think how the AI can really free the time of these doctors to go to the patients and to provide the better outcomes, and simply the system can do the proper mapping and find the trial match with seconds. And we have that already embedded into the our AI platform as a model. In the medtech, the AI plays significant role. It's not only about how we are working with the IoTs and how we are analyzing and predicting with the signals, because obviously the most wanted scenarios are especially related with the telemedicine. We have even the cases where we are doing the theater optimization of the surgery room with the possibility of the AI. Previous speakers were talking of how we are providing support to the relatives of the people who are impacted. Think how the AI can really support what information we are giving to the relatives, to the person who is in the emergency room. Or if we are talking about the virtual care, I can name you a company who is the winner of our startup program called Pegasus. They are building a stethoscope, a digital stethoscope, which you can have at home, and you can examine your child if it is with asthma or if it has some issues with the breath. And it saves a tremendous time, giving you more than 97, if I'm not mistaken, percent accuracy rate, which is much bigger than going and physically visiting a doctor. And many more things are coming. Now we are living and we are laughing at Microsoft that we are in a chatbot era. You can see the chatbot avatars, digital assistant everywhere. And each and every of the solutions you are presenting can be combined with that kind of digital assistant. Call center scenarios. Again, everything you talk about like well-being application, this could be connected with the call center scenario and many more. Being conscious on the time. I'll not stop on the patient as a consumer because see the similar things of patient behavior like the consumer, because he wants to have the better cure, the better information, and looking into the patient journey, not looking just from the front end side, what the patient will experience, but also from the back end, what system and solutions and support from the general practitioners to the post-care personnel we are providing. You can think how you can implement, create first, and then implement the AI solution in each and every cycle of that patient journey. From the prior to the visit, how we are empowering the doctors with providing a summary before the patient even entered the door with the symptoms and with the recommendation, what examination he should put during the visit, just listening and having a triage on the diagnosis, and then care team collaboration and post-visit follow-up care, which obviously is not our best part of the healthcare in our part of the world. Microsoft is not having also the product and solutions available from our general cloud and Microsoft Cloud for Healthcare, but through our AI for Earth previously, and now Microsoft research programs, we're working in an incubation area with many of the academical institutions or research one. And here you can see the projects like INRI, which is for the democratizing medical imaging AI. And because of that project, now we are introducing the new AI imaging models available on our site. Disease and epidemic modeling, which has started with COVID a long time ago. It has started from Canada and Australia, but then it was distributed all over the world for the governments who wanted to predict where the next spread of COVID will be. Project Hanover, which gives us the possibility to go deeper in the precision medicine and clinical trials, and now we have the ready-made architectures for that. And these days, Microsoft Genomics. The import of the genomics data is still in a public preview for our fabric, but very soon you will have the possibility to connect the EMR data with the genomics data and with, why not, social determinants of health data for the better healthcare decision-making, for the better analysis when the next government expenditures should be. Microsoft is a partner-driven company. Everything we do, we are doing with partners like you, with partners like universities, with many startup companies, which will be the next shaping the healthcare future. And that's why I've decided to show you our startup program. Everyone who wants to benefit from what we can provide is first help you build your model, market your model, and why not publish your solution on Azure Marketplace to have the accessibility, someone said, all over the world, not just Ukraine, not just Central and Eastern Europe. You can leverage those resources. Many of the companies you will hear soon are coming exactly from that startup community. One of the cases we have, and which is coming as well from that incubation period, you are talking about the mental health, but it was more about the interaction with the post-care. We are launching, and I can share in the chat window the link. We have developed a model together with KPMG and Sheba Hospital in Israel. Sheba Hospital is the biggest Israeli hospital as part of GOI. We have introduced the project called LIF. This is a mental health application which is intended to serve and to diagnose the people, to support the diagnosis of the people with PTSD issues. And because of the conflict, a lot of people, not only the military forces, are having issues with the mental health stability. And that solution is with 95% accuracy rate. It was literally built on the DCM model, on the DCM book, which is the Bible of psychologists. And now it will be stretched outside the military forces to the teenagers and to the children. It's anonymized. It saves a lot of time for the doctors because only those who are diagnosed with the potential issues are directed to the specialist. And again, it's a digital, and a lot of people really love to have that experience talking with the avatar. Microsoft Research. Once you get familiar with our startup program, go and see how you can apply and be a part of our academic programs, what kind of research tools you can leverage, and what kind of communities you can be engaged through and with us. As a final words, don't forget the AI principles. Whatever you do in the area of AI, it should really follow the security, transparency, accountability, and all of the things you have in mind, just because whenever you provide those solutions, we need to be conscious who will use it, how the data privacy will be ensured, and what will be the positive outcome for that. With that, I am finishing. I can't I can't present everything what Microsoft do these days, But for those who wants to hear more, subscribe to our channel and to our blog. You will hear much more things after the new year, and especially during hymns in US time. And wish you the success with the next work. Are you still with me?
Emma, do you hear us?
Yes.
Yes, super. Do we have any questions from those who are offline, guys? No?
Oh, I see. I presented not the slides, but the notes. Sorry for that.
Okay, I don't see hands at our offline venue. So, Emma, thank you very much for your speech and for your thoughts and insights for our guests and teams who attend Generation H. Thank you very much again. And this applause for you.
Thank you.
So, dear guests and those who are online, we need 5 minutes, and I just recommend you sit here and stay here at the venue. We need 5 minutes till the announcements. We are preparing the certificate. One, of course. Can you turn off? Значить, я даю спочатку. Yeah, I trying to do something like that. Yes, yes, this hint is working. Okay, but no, guys, I mean, our jury members, dear, I want to welcome you to our stage, of course. And before we announce the winner of our Generation H initiative this year, I want to give you the micro, Petro, please. And our jury members share their feedback firstly, and after that, we are starting our celebration.
Okay, thank you. So first of all, I think this was a very strong cohort. So a lot of you have very practical things you're working on, and you're tackling real problems. And I mean, be unstoppable in doing this. The advice I could give you is try to identify a particular pain point within those areas you're tackling and attack this pain point. Think of the use cases, like what would make the user use your product? Because very often the problem as a whole is, well, it's there. We all know it's there, and it feels like somebody needs to fix it, but the problem as a whole could be too big of an issue to tackle. So think of a particular use cases and of a particular pain points of your users that you can help them with, and that would make your product much more marketable and much more attractive from the investor standpoint. And well, that's the way to go. Thank you.
Thank you, Petro. Volodymyr.
Yeah, first of all, it's great progress of many teams because I saw many of you in a previous stage, and today it looks much better. So it's also a good your result, like organizers and also all of you. Yeah, and my advice is think about more about two things. Yeah, it's about problem you solved, and think more globally. Yeah, it's two main points I'd like to hear more today. So, but still, you in a health tech, so you not only about money, you about huge value for many people, because we talk about lives and health. So you should be proud of you.
Thank you everyone today for all of your pitches, for all of your preparations, answers to our hard questions sometimes. What I would like to say is also to say, like, think global, because part of the teams told us that they are focused on Ukrainian market only, or on a specific niche. Well, think in advance, like in 10 years from now, in 20 years from now, what can be with your company, how it can grow, and what problems it will solve. And it will help you to go through this path, and also it will help to your potential investors to understand how they can help you, and to your potential partners, how you together can make this world better. Well, health tech is is growing in the whole world. So you are in the right place. Just find the right advisors, find the right team members, and go fast. Yeah, that's it.
Я перепрошую, я перейду на українську, не тому що в мене англійська погана, але просто я знаю, що це спеціально для вас. Я в абсолютному ейв від вас всіх, починаючи з ідеатону, і сьогодні дуже великі молодці. Враховуючи те, що ви створюєте свої бізнеси amidst of the ongoing war. Я вас вітаю, ви чудові. Проблема, звісно, полягає в тому, що це, можливо, не перша ітерація, але одна з початкових. Над пітчем ще потрібно працювати. Ви маєте розказувати історію. Але я би хотіла бути прямо сьогодні персональною. Нам було важко вибрати, хто сьогодні піде з певною нагородою. Тому я хотіла б сказати про те, що сьогодні ми випускаємо тільки першу когорту. Ми точно не розходимось. Я хочу, щоб ми постійно були з вами на зв'язку, щоб ми продовжували. Деякі з вас знають, що ми, як Tokarev Foundation, дійсно інтегруємо технології в реальну роботу on the ground. Ми працюємо багато з реабілітаційними центрами, з клініками, з навчальними закладами. Та ми намагаємось пояснити, чому тек може бути for good. Ви, як люди, які працюєте в тек, ви знаєте, що у тек є своя black side, dark side. Ось ми якраз боремось за те, щоб показати, що технологія може використовуватись for good, і особливо зараз в умовах ongoing crisis, ongoing war, ми можемо безпосередньо створювати рішення задля того, щоб виходити на новий рівень. Я сьогодні дуже багато почула, і я така, мовчи, тому що, ти не на сцені, мовчи, але я не могла замовчати, тому що всі ми такі, ну розумієте, там, законодавство, все так, регуляції не вистачає, стільки проблем, стільки, sad story and all that stuff. I mean, it's not a sad story, все залежить тільки від нас, наскільки ми будемо brave enough для того, щоб продовжувати любати скалу і виходити на новий рівень, виходити з рішеннями. І сьогодні ті із вас, хто не отримує цей, як це називається? Сертифікат non-equity grant. Я прошу, щоб ви не зупинялися. Я прошу, щоб ви завжди були проактивними. Щоб ви писали, щоб ви стукались, казали Tokarev Foundation, або Set University, або Investing Fund, друзі наші, партнери. Будь ласка, давайте подумаємо, який проєкт ми можемо створити. Давайте я по-іншому якось запічу. Давайте я покажу, як я допрацював свою роботу. Будьте проактивні, тому що це в ваших руках. І важливо також ще сказати, що для нас, як для філантропічної, технологічної філантропічної організації, ви є нашим шоукейсом. Ми тільки повернулися з Більбао. Я вже казала, 360 передових імпакт-інвесторів Європи. Ми розказували про Україну як про рішення, і вони слухали нас з відкритим ротом. Знаєте чому? Тому що те, що ми робимо тут і зараз, вони не можуть собі дозволити зробити. Да, через регуляції, да, через те, що вони не можуть збирати таку дату. Але зрозумійте це, що не потрібно йти завжди conventional шляхом. Треба бути brave і в хорошому сенсі mad and bold enough для того, щоб робити зміни. Один з вас сказав речі, з якими я повністю згодна. Стартапи не мають йти під копірку і робити якісь Excel-таблички, які комусь будуть виглядати добре. Стартап має бути достатньо crazy і вірити в свою big dream для того, щоб правильно його підчити, для того, щоб правильно вирішувати проблему і зробити найголовніше. Ви маєте fucking вірити в те, що ваше рішення допоможе humanity. І багато хто із вас сьогодні дійсно був дуже-дуже близький, щоб мені це артикулювати. Дякую.
Дякую. Thank you very much. I'm switching to while we're photo shoot our jury members, I'm switching to English. And before we are announcing and waiting for this big moment of the winner, but before that, I need to mention that we have an additional partner for this part for our demo day. That's product our company, and we have a mini grant for go-to-market strategy for one of the team. And our jury members decided that it will be ApexMed. So, ApexMed, your with additional price with your go-to-market strategy that you will have from the team of Productor. And we are going to the very big moment. And the team that today's celebration will be X10 was presented by CTO, and that's an incredible moment for all AI. That's yours. So, Oval AI is our winner for the first cohort of Generation H, and we are happy to announce that. Yeah, okay. But and just leave all these great people on the stage, and I want to welcome all the teams to this stage and make this great photo and hugs together.
Окремо в нетворку ми готові розказувати, хто був ще нашим фаворитом. Але не під запис.
Залишаєтесь для фото. Так. Да. Ти по центру. Так. Мене можна вимкнути.
Так, не знаю, що сказати. Я почав з того, що I'm so excited to open this session. І тепер я X10 excited виграти цей приз. Хотів би подякувати всім організаторам. Це було дійсно круто, це був нереальний експірієнс, це був нереальний буткемп. По-перше, хотів би подякувати організаторам Set University, Токарев Foundation. Дуже класний івент, дуже класна організація, структурована подача даних, все круто, прям максимально класно. Також хотів подякувати учасникам. Ми за ці 2 тижні стали такою маленькою сім'єю. Stay in touch, будь ласка. Всім бажаю дійсно бути brave.